Good evening and welcome to everyone joining us here today. My name is Shayla Favor and I serve as the Chair of City Council's Health and Human Services Committee, and I'd like to call this hearing to order. Tonight's hearing is to discuss proposed amendments to Columbus Public Health's legislation to regulate the sale of flavored tobacco in the city of Columbus. The proposed amendments are live and can be accessed at www.columbus.gov/tobacco. City Council has prioritized listening to all voices in the community since the beginning of this process. To date, we have had multiple meetings with stakeholders, hosted 5 events to hear from our community, and taken many calls and emails. A few days ago, we shared Council's proposed amendments to the legislation. In the draft, feedback provided by residents throughout our engagement process are taken into account. I will reiterate, this is still only a proposed version of the legislation. Our city attorneys continue to debate exemptions and the legality under Ohio state law. Tonight, we have Deputy City Attorney Laura Baker-Morrish here, who will help answer some questions. Additionally, we continue to work with Columbus Public Health on increasing penalties based on feedback we've heard from some groups throughout our engagement process. Health Commissioner Dr. Myshika Roberts is here with us, and we will hear from her in just a moment. I also want to take a moment to make it clear that this proposed regulation will not criminalize or penalize individual behavior. It will focus on civil enforcement of the retail sale of flavored tobacco products. We have First Assistant Chief Potts, who will speak to that tonight. Shortly, you will hear from Dr. Roberts, who will present on a few topics we have been discussing over the last few weeks, and from Chris Maitland, who was in Council's Legislative Research Office, who will walk us through the proposed amendments. After that, we will open it up for public testimony. I will call names from the speaker list, and you will have 3 minutes at the podium to speak. Before we begin, I would like to quickly say, while I have not made my decision yet, I can ensure that it will not be an easy decision. I have been intentional in a lengthy engagement process because I truly want to understand the impact this legislation could have. We know that Black Americans and youth have been victims of targeting from tobacco companies, and we also know that this legislation could have an impact on businesses in our community. The truth is, we want to make sure that individuals and families in our community can keep their jobs and also protect our youth. City Council has been looking into ways that the city could support businesses in lieu of passage, as well as pushing our city attorney's office on the possibility of other exemptions. Regardless of the outcome, I can assure you that this has not been an easy process, but it has been a fair process. And I appreciate all of our residents that have taken their time to share information with us and help answer our questions. With that, I'd like to take a moment to acknowledge my colleagues that have joined us here tonight. President Pro Tem Elizabeth Brown, if you'd like to make any initial remarks.
None, just to say thank you to you, Chair Favor, for the opportunities that you've created along the way for public feedback and for hosting this tonight. Thank you.
Thank you. Council Member Nick Bankston. All right, with that, I will turn it over to Dr. Roberts.
Good evening. I apologize. I didn't realize I was next on the agenda. Good evening, Chair Favor, President Pro Tem Brown, and Councilmember Bankston. Thanks so much for having me this evening to talk about a very important subject. Public health has been busy over the last several years, and this is still a topic that is near and dear to us and something that we feel strongly about that our community needs to help address the racial disparities we see in Columbus and surrounding areas as well. So with that, I have a few slides that I'd just like to walk all of you through to talk about the proposed flavored tobacco regulations that we have. So this slide shows you the leading causes of death here in Columbus per 100,000, and we're particularly looking at our residents who are 15 years of age or older. And what you see here, the leading cause of death are heart disease. You also see cancer, you see accidents, and you see cerebrovascular disease as well as chronic lung disease. What I think is most important is for you to realize that 4 out of 5 of the top leading causes of death in Columbus are exacerbated by tobacco or e-cigarette use. So 4 out of the 5 leading causes of death right here in Columbus are exacerbated exacerbated by tobacco or e-cigarette use. And obviously, that third cause of death, accidents, particularly from guns, is something that we're working on with you as well to address. Whatever we can do to reduce the use of tobacco products in our community will make a significant difference in the well-being of our community, as well as the health and livelihood of our community. So I just wanted to point that out. Then when we look at the health of our city, we know that about 25 or a quarter of our residents smoke. What is most concerning is 1 in 4 adults smoke, but if you look closely, 1 in 3 African Americans smoke. So the prevalence of smoking in the African American community is much higher. Also, when we look at smokers, when we compare 2017 and we compare that to more recent data, we see that smoking has increased from 2017 to 2019. Those are smoking rates per 100,000. And so we see a significant increase. Now, this is smoking of all tobacco products. And on my next slide, I'll kind of break down the difference in tobacco products, which is also very concerning. But as of 2019, there were 185,000 smokers, which was actually a 15% increase, 185,000 per 100,000, 185 per 100,000. So let's talk about all different tobacco products. So we know we talk about cigarettes, but then we also talk about other tobacco products, which includes vape. So what this slide illustrates is the statewide cigarette and other tobacco products tax collections from fiscal year 2019 to fiscal year 2021. So over a 3-year difference, what we did see across the state is a decline in cigarette tax collection in Ohio of about 2%. So you could argue, well, that's good. That means less people are smoking or less people are buying cigarettes. But then during that same time period, we saw that tax collections for other tobacco products increase, and that increase was by 32%. So although we saw a decrease in cigarette tax collection, we saw almost a 10% more increase in other tobacco products. So although less people were smoking cigarettes, more were introduced to other tobacco products like vape. I do not believe that data would make the assumption that all of those people who stopped using cigarettes moved to vape products, because the delta, the increase in other tobacco products is so much greater than the decrease in cigarettes. And that's what we need to be concerned about, and that's what we need to worry about. And that's why we feel that vaping and the flavored products that go with vape are a harm to our community. And so this next slide really helps describe some of this. So I know there's been lots of discussion here in our community as well as across the United States about vape as a cessation product, and is vaping a cessation device? And I think you've all heard me loud and clear that I've said it is not. The FDA has stated vaping is not a cessation product. It has not been approved as a smoking cessation product. So I just want to show you a few things. So if you look at the vape product, it contains 5% of the nicotine strength. So 5% of the nicotine strength. But one pod that you can buy is the equivalent of 60 cigarettes. So let's think about that for a second. You can go and buy one pod plus the device for about $20 or so, and you get the strength of 60 cigarettes. That is not a cessation device. If you just put that, the numbers, that is not a cessation device. So I just want to make sure I'm very clear about my perspective, but not just my perspective, the FDA's perspective on that. Now, we've had several local experts come and talk to you and to this community about the flavored tobacco ban, and many of them, I think none of them could be here this evening, but I just want to remind you as well as the audience of what we heard from those experts right here in our community. So Dr. Dubune, who is at Ohio State University Wexner Medical Center, said very clearly, anything that hurts the public hurts people like me as an African-American man twice as bad. So we have to think about that and, again, focusing on the disparity problem. Then we heard from a pediatrician at Nationwide Children's Hospital that said that this vaping epidemic is in our schools and it's in the emergency department at Nationwide Children's Hospital. We heard from Dr. S.B. Bell, who is an ER doctor, and she said that the vaping epidemic is taking a toll on our children, and it's just the beginning of the tragedy. And she's seen youth in her ER with respiratory disease and lung disease because of this vaping. We also heard from Dr. Joseph, who was not only a practicing physician at Ohio State Wexner Medical Center, but also representing the American Heart Association and the African American Male Wellness Association. And, he made it very clear that cigarettes and tobacco are hurting our community, particularly our Black and brown community. And then we heard from Dr. Kruasulas at Mount Carmel that the chemicals in the products, particularly these vape products, but also in cigarettes, are hurting humans and are killing our community and leading to all the chronic conditions that increase mortality in our community. So it's not just me. It's our experts in our community, many of which we trust. We put our healthcare in, and they express their concerns about what tobacco is doing to not only our youth, but also our adult population. I think everyone knows that we've had Tobacco 21 for a few years now in Columbus, and we've been doing compliance checks on our businesses. And there's been some discussion that certain retailers might be more compliant than others. And this slide just shows you over a 5-year course from 2017 to 2022, what the compliance rate is for tobacco retail licensees versus vape-only retail licensees. So they're about the same, which is concerning because they're low, in my opinion. A 64% compliance rate is not at all what I would want to see. But the point that I really want to make here is there's no difference between a tobacco retail license compliance rate and a vape-only retail license compliance rate when we do our compliance checks. So with that, just want to remind you of some really important things. Again, we're talking about 25% of our population, 1 in 4 Columbus residents, adults smoke. 1 in 3 Black Columbus adults smoke. Tax collections on all tobacco products have increased, on particularly other tobacco products, not cigarettes. And cigarettes, this is a really important note that I want to leave you with. Cigarette smoking cost in Ohio is a $6.8 billion industry. $6.8 billion in healthcare costs of cigarette smoking just in Ohio. And so if we extrapolate that to what that means for Columbus and Franklin County, obviously it will be a little less than that, but still, that's a very high number. And to think that we could make a dent in that, we could reduce that by banning some of the products that make it very enticing and inviting for people to start smoking or to continue smoking. So with that, I'm happy to answer any questions you might have, but I thank you for your time this evening.
Thank you so much, Dr. Roberts. Do my colleagues have any questions at this time? Dr. Roberts, I have a few questions. So there's been a lot of discussion about vape and traditional cigarettes. Some say that vaping is better for health. Others say that it is incorrect. And others say that the evidence is inconclusive. Can you speak to that from a health perspective?
So obviously, vaping still has tobacco products in it. So I can tell you what the experts say, which is what I follow. I'm not a pulmonologist. I'm not a tobacco expert. I am a physician who cares about the health and well-being of this community. And as a medically trained physician, I know that tobacco in any form is not good for your health. Now, if vaping is a cessation product, it would have been approved by the FDA as a cessation product. All other drugs, as well as vaccines, are approved by the FDA. Vaping has not been approved by the FDA as a cessation product. It hasn't even received any temporary guidance or temporary label for that. It has not been approved. So yes, there could be some individuals who feel like vaping could be a cessation product. It could have helped some individuals stop smoking, but I would liken it to, people saying, they took some vitamin and it was a weight loss product. If it has not been approved by the FDA as a product that targets that condition, in my opinion, it should not be touted as a product that could be a smoking cessation product.
Last night at our business conversation, there was some discussion around the policy in UK that I believe has or is touting vape as a cessation tool and has gone through the equivalent of our FDA process and has been solidified there. What would be the reason why, if all things being considered, they are the same, our FDA compared to what their FDA equivalent is over abroad, would there be changes to the content of the juice, for lack of a better word, that would need to be made in order for it to become a cessation product in the States?
So I can't speak to the UK's approval process for allowing vape to be a cessation product. I think your question would be better asked if you were to ask one of the manufacturers of vape why they have chosen not to submit their product to the FDA as a smoking cessation product. So I want to make it clear, the FDA has not said it is not a smoking cessation product. The manufacturers of a vape in the United States have not presented data and asked for their product to be a smoking cessation tool here in the United States.
One of the other points that we heard last night from one of our business owners is really around the line. Where does the line for public health get drawn, right? So if we are now talking about banning tobacco, flavored tobacco in our community because it's harmful, and Assistant Health Commissioner responded to this question last night, and I appreciated his response, but I just wanted to get your perspective as well. If we're attempting to ban flavored tobacco in the city because it is harmful, well, then what should stop us from going after soda or going after cheeseburgers?
Well, for me, again, my role is for the health and safety of our community. And there is a product that was developed for companies to make money. And they have intentionally, from the very beginning, targeted Black and brown individuals. And then when we look at the data, we know that Black and brown individuals here in our community, as well as across the country, have higher rates of chronic disease. And then you add tobacco use on top of that. And so now they have higher rates of chronic disease and then higher rates of mortality as a result of those chronic diseases because it's further progresses with the use of tobacco. I think here in Columbus, we have done many things to improve the well-being of our residents. And knowing that there is a product out there that is disproportionately sold in low-income communities and in communities of people of color, I think, and it's harmful to you, this is the right thing for us to do. This is the necessary thing for us to do, because the people that they're targeting are addicted to this, and they got addicted to it because they were intentionally targeted to use this as a cool method. And we've heard that from past smokers in our community. In terms of what will stop us from going further, my response to that is I will continue to advocate for our community and what I believe will make our residents healthier and safer. And if that means, putting a tax on sugar beverages and things of that nature that other communities have done already, we aren't not the first. I am open to that. But right now, what I am focused on is tobacco and flavored tobacco, because it is harmful to our community and it disproportionately affects our minority community.
And my last question at this time was really just around sharing the compliance data for sake of transparency, but also from what we'll call those good actors in good business actors in the community that are that have been good retailers, if you will, and do their due diligence to ensure that they're not selling to underage individuals, almost having an opportunity to mentor those who are continuing to fail those compliance checks. Is that something you are looking at in the future?
I think we're looking at a lot of different things to try to increase our compliance rate. Obviously, we've done a lot of education, and before we started our compliance checks, when we first rolled out Tobacco 21, we did a lot of education. If this were to pass, we would do a lot of education as well with our retailers. We can do buddy systems with some of our more successful businesses, with some of our less successful businesses. We're happy to make those connections if that is something people are interested in. We also know that we have, as a result of this proposal, we are increasing our tobacco license retail fees, as well as some of our penalties, hoping that will really get rid of some of the bad actors. So we're open to a lot of different suggestions and ideas so that we can have more compliance in our community with tobacco retailers.
Thank you, Dr. Yes, President Pro Tem.
Thank you, Chair Faber. I wanted to go back to the prior point, the prior question about substances that are harmful to our health. And what I wanted to ask specifically is for you to talk about the addictive nature of tobacco and nicotine, and how that differs from, not to minimize unhealthy eating, it's actually is a real health concern in our communities. But, for your average person, if you use a cheeseburger as intended, right, what those health consequences are versus using tobacco products exactly as they're intended and what those health consequences are. And so if you could talk a little bit about that sort of addictive nature.
Sure. That's a great point. And thank you for mentioning the part of using it as intended. And so whether you're talking about a cheeseburger, whether you're talking about a sugary beverage, or whether you're talking about alcohol, if you use it as intended in moderation, it is not addictive. You can get some good caloric content from a cheeseburger. You can do well with sugary sweetened beverages in moderation, as well as alcohol in moderation. Those three products that I just named were not intended, were not created, and are not known to be addictive. Compare that to tobacco products, where they are created and are known to be addictive. And then when you flavor them, that makes it more palatable for the user. And so that further solidifies the addiction. We don't see that in other things. We don't see that in French fries, for example. We don't see that in Pepsi or Coke or whatever your sugary sweetened beverage might be. So it's a very different makeup and a very different intended purpose.
Thank you. And just one of the ways I think about the flavors too is particularly when we're talking about younger people and how if you're addicted to something at a younger age, how that informs your ability or not to undo that addiction, over your lifespan. And flavors, to exactly your point about masking the effect to the user is really important. So thank you.
You're welcome.
And if I could take a moment just to acknowledge two of our colleagues that are joining us via WebEx, Councilmember Remy as well as Councilmember Barosa de Padilla. On behalf of my colleague, Councilmember Remy, he would like for you to just talk about our cessation programs that are available and if we are looking to roll out anything that would complement this potential ban in the city of Columbus.
Yeah, excellent question. And so we do have cessation programs here in Columbus. Columbus Public Health has a small one. As many of you know, the state of Ohio has a quit line that can connect you to smoking cessation programs. And many of our healthcare providers here in Columbus offer smoking cessation. We have made a recommendation and highly suggested that we need to increase those smoking cessation services here in Columbus if this proposal were to pass and make it more accessible to everyone and more affordable to everyone in our community. And so we have been working closely with you, Chair Favor, and others to try to make sure that that becomes a reality so that our residents will have the proper support to stop using tobacco products before this ban would go into place.
And correct me if I'm wrong, but are most cessation programs targeted towards adults? So if we are, our campaign, the campaign that has been presented has not only had a racial equity focus, but it's had a youth focus, right? And I can only imagine that what would be applicable to an adult is not going to work for a middle school or a high school age person.
Yeah, you're absolutely right about that. Most of our smoking cessation programs here are geared towards adults. And so we will need to work with our partners at Nationwide Children's Hospital and other partners in the pediatric community to help us make sure that we have cessation programs that are geared towards those youth, whether they're adolescents, so that we can make sure that they're successful in their smoking cessation journey as well.
Thank you so much. All right, we will now move on to First Assistant Chief LaShawna Potts, just to provide us an overview. We've been having very candid conversation about the enforcement of this potential policy in the city of Columbus, and I have been very candid with my position that this in no way, shape, or form is meant to be another target towards our Black and Brown communities. We don't want to deepen any negative relations between police and our residents as it relates to criminal activity in any shape or form. And so this specific piece of legislation carries civil penalties. But what we have heard testimony from folks in law enforcement, that there is the potential for an illicit market to pop up once a ban like this could be passed in the city of Columbus, and that should someone engage in that illicit activity outside of someone's store, that there will be no way to take those guys down. From my perspective, that appears to be a different crime, right? That would carry with it criminal penalties, but we would like to hear that perspective specifically from our officials at Columbus Police Department.
Good evening, Chair Favors and President Pro Tem Brown and Councilmember Bankston. On behalf of Chief Bryan, Chief, and the division have taken this stance, and our position is that we will not be engaging in any enforcement and/or investigations if this proposal is passed. And that's where we stand.
And so, not being out of the legal world just a little bit here, I would imagine that we would be looking at something that would be close to trafficking if someone was starting to sell cigarettes on the street or out of their vehicle or whatever it may be. That is a that is a crime that carries with it separate penalties and would include a separate type of investigation outside of this. Is that correct?
That is correct.
Okay. Do my colleagues have any additional? Yes, Councilmember Big. Oh, okay. I knocked it out. Okay, thank you. Thank you.
Thank you.
Chief Potts. And if I could take a moment from our Columbus City Attorney's Office, do you have anything to add as it relates to just civil penalties versus potential criminal activity?
Thank you, Councilmember Favor, or I should say Chair Favor. No, the only thing the City Attorney's Office would add in relation to that is that Assistant Chief Potts is absolutely correct. As written, this particular ordinance would be civil infractions only. There are existing provisions of the Ohio Revised Code related to trafficking in cigarettes and or selling of cigarettes without a valid license or selling to underage. Those are not impacted by this legislation, but our legislation that's looking only at flavored tobacco and banning flavored tobacco is civil only in nature.
Thank you for clarifying that, ladies. All right, we now will have a presentation from Chris Maitland, who's with our Legislative Research Office, to present on the proposed amendments as they are today.
Thank you, Chair Favor. I will be discussing the proposed changes to the regulation of flavored tobacco, ordinance number 3253/2022. Briefly to go over the initial proposal from Columbus Public Health. It defined flavored tobacco, prohibited the sale of flavored tobacco in the city of Columbus, and the Board of Health was given the opportunity to promulgate certain rules. The rules that they were proposing to promulgate were to adopt the definition of flavored tobacco in a similar manner to adopted by the city of Columbus, as the Columbus City Council, enforce the prohibition against the sale of flavored tobacco, increase the retail license fee currently at $150 to $350, and change the civil penalties for violations for flavored tobacco. These violations would also apply to Tobacco 21. That would be $1,000 for the first offense, $2,500 for the second offense, and $5,000 for a third offense, and loss of license for remainder of licensing cycle and the next cycle. Currently, tobacco licenses are for 1 year. The proposed changes to 3253/2022 include a ban on flavored tobacco products that would begin on January 1st, 2024, for all banned products, to have equality for those, as well as to give businesses an opportunity to deal with inventory, as well as for consumers to deal with any sort of cessation necessary. Hookah bars would be exempted from this flavored tobacco ban, provided that they are licensed to sell tobacco in the city of Columbus by Columbus Public Health, that they follow all local and state laws, and that the flavored tobacco products are only consumed on the premises. This amendment would also allow wholesale dealers, distributors, and vapor distributors to sell and distribute tobacco products only in the dealer capacity, which means that if a wholesaler was operating in the city of Columbus but not selling the product, just possessing it, they would not be in violation of this law. As well as City Council will work with Columbus Public Health on an appropriate license fee and fine structure. Thank you.
Thank you, Mr. Maitland. Do my colleagues have any initial questions for Mr. Maitland? And I believe this could be for Mr. Maitland or Dr. Roberts. As it relates to fines, this was one of the major points that were we heard reiterated from our retailers throughout this process, was that the fines were not punitive enough. And so what we're seeing is not only an increase in the retail license, the license itself, which is considerably, as it stands today, lower than all of the other major cities in the state of Ohio.
Thank you, Chair Favor. I'm going to toss that question to Assistant Health Commissioner Edward Johnson. He oversees this area and has been heavily involved with coming up with these numbers with my guidance, so I'm going to let him respond. Thank you.
Chair Favor, members of council, yes, the proposal before the Board of Health would raise the license fee from $150 to $350.
And what we know is perhaps not on average, but maybe it is on average. I'm not sure. You can correct me. It's $500 is what we're seeing.
Yes, we've seen $500 license fees in other Ohio cities and around the country.
Okay, so not only an increase in the license, but also an increase in the penalties. And I know as we have been having conversations about what this penalty structure looks like, you know, from my perspective, if we're at a place where we're calling something a public health crisis, then the penalties should rise to the level of being punitive, right? To disincentivize that behavior that we're seeing in our community. It should not be at the level of a parking ticket. And so I know, for one, I even heard a gentleman say last night, the first offense should be $10,000. And he may not be wrong. But to that point, we want to demonstrate that this is a problem in our community, and we see it as such. And the fines should definitely reflect that. I have a few questions for Deputy City Attorney as it relates to the presentation provided by Mr. Maitland. The 2019 legislation in Toledo that halted all sales of pre-filled flavored cartridges but left open system flavored products available to vape shops to sell has been discussed a lot in our business meetings. Excuse me. Do you think Toledo's ordinance would hold up in court?
So Chair Favor, it's difficult to say whether or not a particular ordinance would or would not hold up in court. It depends a lot upon the evidence that's presented, the judge that is the one that is hearing that particular case, and what the case law is in that particular district, which is different from ours. What I can say is that any court that's going to be looking at a particular piece of legislation is going to look at it on a number of different levels. They're going to look to whether or not it's vague or overbroad. They're going to look to whether or not there are any violations of constitutional provisions. And then they're going to try to look at whether or not there are any state preemption issues. So addressing those three kinds of things, in terms of the vagueness or overbreadth, the legislation in Toledo seems similar to a number of similar pieces of legislation across the country. I have not been able to find in my research any challenges to vagueness or overbreadth that have been successful related to the legislation. In terms of equal protection, that's very much a case-by-case specific question. And so when we're talking about equal protection as related to something like this, a regulatory act by a legislative body, and we're not talking about any suspect classes, we're not talking about First Amendment chilling, so we're talking about rational basis review, which is a lower standard, not strict scrutiny, not intermediate scrutiny. We're talking about a lower standard for equal protection. The question that any court is going to look to is what was the harm that was identified by the legislative body that is a public health harm or safety harm or anything within the legislative body's police powers to attempt to abate. And then once they've identified that harm, have they articulated a response to that harm that is intended to abate or mitigate that particular harm? that the response that's articulated by the legislative body doesn't need to be perfect. It doesn't need to completely abate the harm that's been identified. It can be done in stages. But what you must have is some record that the legislative body has of what's going on in their community, what harms have they experienced, and why they think that that harm is related to the act that they are putting forth in order to abate the harm. So in the case of Toledo, what they did there is they indicated that the harm that they were looking at was the harm of vaping to people who are under the age of 21. That was the articulated harm within Toledo that they observed on their streets, that they had testimony regarding, and that they sought to abate. They had testimony within Toledo, and they placed it within their legislation, that in FDA checks from 2011 to 2019 in the city, there were hundreds of violations of sales to underage, but in that particular community, there were only 6 that were done by a specialized vape store, as opposed to the hundreds that were done by stores that were not. But that's very specific to Toledo. That was the experience that they had. That was the testimony that they saw. And as a result, they went and changed their original act that they were going to ban everything outright. And they instead created an exemption because they had before them data to suggest that those particular entities were taking the steps necessary to not sell to underage. And that was their articulated reason for enacting. So in Columbus, as we're considering different options, the question that council must consider and that we at the city attorney's office in providing advice to council would be considering in providing our advice is what is the record in Columbus? What is the harm that we are attempting, that council, I should say, is attempting to abate? And is the action that council is seeking to take an action that would seek to mitigate and or abate that harm? So the mere fact that another city has enacted something doesn't mean that we can do it too. It's certainly not uncommon for cities to look to other cities for language or for advice about how to respond to a particular harm. And you certainly don't have to wait until it comes to Columbus if you know that a harm is likely to come. But what the city does need to have is a record before them of what is the harm, what is the concern, what is the current practice in Columbus, and then it needs to adopt legislation if it seeks to abate that harm that is going to have a nexus to the harm that they've identified.
So could a revenue threshold from tobacco and/or flavored tobacco sales serve as a means to define different types of tobacco retailers?
I'm sorry, could you say the very first part? I didn't hear it.
Yeah, could a revenue threshold, so let's say 60% of your sales or 80% of your sales from tobacco or flavored tobacco serve as a means to define different types of tobacco retailers?
And that's going to depend as well. So at the state level, there is a definition for what constitutes a retail tobacco sales, retailer, sorry. And there's one for vaping as well. But that particular definition came out of the attempt by the state to provide particular exemptions related to the indoor smoke-free tobacco ban. And so some of their assumptions about why they are or are not classified as that kind of a retailer had to do with the harm that they were attempting to abate, which was the harm of employees at a particular employer's business location being exposed to secondhand smoke. So they were looking at, okay, well, how much percentage of your business is going to be consumed by this particular product being sold? That's going to be a guide for us as to whether or not this is a particular business that is engaged in, selling smoke products, such that we can determine if you are an employee there, you have made a conscious choice that you're working at a place where you're going to be exposed to smoke. So that was the rationale. And whether you agree or disagree with it, that's the reason that they came to that particular determination. In Toledo, they have a 60% threshold. Unfortunately, it's not articulated within their legislation how it is that they came to 60%. That is something that we would want to hear, and we would want to know, again, how that's related to the harm that the council has identified that they're trying to mitigate. So it's something that is able to be done. The question of whether or not it ought to be done is greatly going to depend upon what is the harm and what is the evidence in Columbus.
Okay. I'll save that one then. Some have argued that disposable electronic devices are more accessible to youth than reusable devices. If we could clearly define reusable versus disposable electronic devices, could those be treated differently? And I believe this is going to be,
It depends.
yes.
Yes. You know me all right, too well. It depends, and it depends on all the reasons that I just articulated. So if Columbus had evidence, or if there was evidence available through a national study of some sort, it doesn't have to be, in this particular question, doesn't have to be specific to Columbus, because this is a more of a national question. Do we find that minors are disproportionately more likely to buy one kind of product than another kind of product? And can we easily differentiate between those products? So those are two different questions. One is whether or not we have identified a harm. The second question is whether or not we are able, both through legislative language and also through enforcement actions, to clearly differentiate between the two types of products. So again, it's possible, but those things need to be available in order to make those determinations and then go forward and have legislation that would treat them differently.
And I believe this one is going to, you will have the same response. Nicotine levels have also come up as a way of, as a means of regulation as well, and getting some of those higher nicotine products off the market so as to
Right.
once again, attack the problem that we're trying to cure here.
And again,
Yeah.
that would, same sort of thing. Do we have evidence to suggest that if we were to take the higher level nicotine off the market, that would then discourage individuals from not just buying more of the lesser amount? Or is the smoking, the manner in which these are used such that would actually decrease the amount of nicotine that's used? And that's one of those things where you would want some sort of an expert in that field to come forward and talk about nicotine usage, nicotine responses to the body, those sorts of things. If council had information before them regarding that and then made a determination, based on this, we think we're going to start first with the worst harm. As I said, council doesn't have to do everything to abate a harm that's identified, but it must have something before it by which it's making its determination, and that determination must be reasonable and reasonably related to the harm you're attempting to abate.
Dr. Roberts, can you confirm, we have a little over 800 licenses in Columbus?
820, so yes, just a little over 800.
820 licenses in the city of Columbus, which to me is just mind-blowing. Is there a way for us to cap licenses in the city of Columbus?
Possibly. So the question of capping licenses has to do with the extent to which the revised code does or does not seek to preempt the city's ability to do so.
Okay.
So there is case law that's out there that's supportive of the idea that if a governmental entity is seeking to lessen either the administrative burdens and/or lessen the availability of a particular product within their city that has been identified as harmful to the city, there is case law out there to support that that's the kind of thing a local government could do. So now the second question is whether or not the existing scheme in the state of Ohio related to licensing of tobacco products, particularly cigarettes, is or is not going to be a bar to being able to do that. There is a defensible argument that it's not, that the licensing scheme in the state of Ohio is related specifically to the ability to apply the taxes that are necessary to be applied to tobacco products, specifically cigarettes, but that has not been tested. And so that's something that we would need to think about. And then even if we could determine that legally we could do this, then the second question would be the one that I started with, which is if we are limiting the number of licenses, how is that related to the specific harms that we've identified as existing, and does that work to further our policy goals related to those harms?
Yes, Councilmember Bankston.
And I just have a question because I know we had talked about it a bit. The biggest thing that I wrestle with this is enforcement, right? Even if we want to reduce the harm, if we're not able to enforce it, then it's all for naught. And so I know that it's come up in my discussions of this loophole around licensing. And what are some of the ways that we can get around it. And so basically, folks get fined and they can continue to get fined, and all they have to do is just go change the name of the business and can get another license and continue to operate. And so I'm just thinking about the enforcement piece of it and how we are able to look at that piece as well. So I'm not sure if you have any guidance on that at all. I know it's a fresh conversation we just had, but just wanted to make sure that that was spoken to as well.
Thank you, Councilmember Bangston. Chair Favor. Yes, I'm aware of the concerns that there are related to individuals who have a license in the city of Columbus, and after they get to a certain point in terms of fines or violations, I should say, there is an ability to create a new LLC that then owns that particular store and then seeks another license. That is possible. That's possible in a number of regulatory areas. So the question that has been asked of me is whether or not there's any ways to address that, and I think there are some ways that we could take a look at in terms of how we define who the licensee is, in terms of how we define prior history as to individuals who are seeking a license. And if we can articulate that and demonstrate through actual data that this has in fact occurred, and I think our health department would be able to provide information regarding how often that actually does occur, then the council could determine whether or not that's something that occurs often enough that we need to engage in that kind of exploration. The other thing that I mentioned during some conversations that I've had is that there's the possibility that if somebody continuously violates a provision of the Columbus City Code and or the Columbus City Health Code, there are also some civil actions that our office could consider. I have not yet vetted that, but that's something that we can also definitely look into to determine whether or not we can prohibit actors from essentially attempting to avoid their responsibilities.
And Chair Favor, I just bring that up because that comes out of, we're still listening, and we have been listening to folks. And that came directly from our conversations with small business owners that, put the hammer down on those bad actors. And in order to do that, we need to make sure that the enforcement is able to be enforced and stick. So that's why I wanted to bring that up so that folks understand that we are listening. That came directly from our small business community.
Well, yes, President Pro Tem.
If it's all right, Chair Favor, Attorney Baker Morrish mentioned compliance checks as she was walking through some of the potential legal argumentation in Toledo. And so I don't know much about Toledo's compliance setup. I do know from when we passed Tobacco 21 that our health department has a pretty rigorous compliance check system that I don't know how many other cities have devoted that level of time, attention, blood, sweat, and tears into this. And so I wondered if there was any in local data to glean that was relevant, Chair Favor, if I could ask about that now. It's not to Attorney Baker Morrish, so I wanted to go through you to them. Okay.
Thank you, President Pro Tem Brown, Chair Favor. I think based on the compliance slides that we were able to share, obviously we know the whole universe. I know that this question was asked last night as well relative to kind of those vape-only stores, and in listening to Attorney Baker Morrish's presentation, I know for us, when we kind of suss out that vape-only store categorization, those are establishments that have identified 80% of their revenues coming from vape products, and then they've also provided a signed affidavit to Columbus Public Health that 80% of their revenues come from vape products only. So that is very specific to that subset of stores identifying themselves that way to Columbus Public Health as a vape-only establishment or a majority vape establishment.
All right, if there are no further questions, we will move on to the public testimony portion of the evening. Just a reminder, when I call your name, please come up to the podium. You will have 3 minutes. Please state your name and any organization or business that you might represent. Up first, we have appearing virtually will be Rima Corey, and following Rima will be Rob Crane.
Good afternoon. My name is Rima Corey. I'm General Counsel for Fumari, which is a premium hookah tobacco manufacturer. I'm also one of the founding members of the National Hookah Community Association, which was established to protect and preserve the rich cultural tradition of hookah. If my video screen was on, if I knew how to turn that on, I would show you what a hookah looks like. Hookahs are 3 feet tall. They're usually very ornate. If you go into any Middle Easterner, Turk, Indian, Persian, Armenian, North African family's home, you would see that it's a symbol of our culture. It is the centerpiece for celebratory events and special occasions, and just to congregate and connect with each other, which is why our organization is here today, and we appreciate this opportunity to share about our culture. And we obviously want to preserve our right to practice our cultural traditions. It's very important to these minority community members, along with these entrepreneurs and small business owners that would be affected. Hookah lounges are often safe places for people to come together and congregate and connect. But it's not just the lounges. Hookah is something that's not only practiced in a lounge setting, but also in the privacy of people's home, which is actually during COVID a very important aspect. I mean, older people that don't want to be in a social setting want to be able to enjoy their hookah and their cultural practice in the privacy of their home. But it's not just that. I mean, some people, because of COVID, just want to be in their home and not out and about. And so we obviously would ask, City Council to please consider how hookah is used in practice, and to consider an exemption for lounges and at-home use. So that would be at retail. And of course, we appreciate any of your consideration, and that the Columbus celebrates diversity, and that's taking the time to understand what hookah is and isn't. It's obviously very different from vape, and as I have testified in the past, kids are not using it. There's no hookah epidemic. It's not being confiscated at schools. In fact, according to the CDC and FDA, hookah use amongst teens and middle schoolers are around 1%. And that number has been going down over the past 10 years. So, it's a very unique product. You often only see it in 21 and over establishments. You don't see kids running around with 3-foot hookahs. So I just want to thank you for your consideration and your time. And we just again ask that you please exempt hookah for both hookah lounges and in retail. Thank you very much.
Thank you. That was almost perfect on the timing. Thank you for your testimony this evening. Welcome back to council, Mr. Crane. Following Mr. Crane will be Gregory Wellingoff. I know I've mispronounced that.
Show and tell.
Wonderful.
So, talking about hookah, I brought some stuff. What goes into hookah? And that's actually inside. And we'll talk about that. I'm talking about 3 minutes yet. So, of course, what the hookah she was talking about was this. Not 3 feet tall, but it's certainly a hookah. Let me grab my testimony here. Councilmember Favor, members of council, Councilmember Brown. You've met me before. I'm Rob Crane. I'm from the Preventing Tobacco Addiction Foundation. I'd like to speak tonight against the proposed exemption for flavors in hookah. I don't need to reiterate what many people are going to tell you about the dangers of hookah. It's unhealthy, it's addictive, and eventually it's deadly, perhaps more so than cigarettes. If you haven't already been to a hookah bar, I invite you to go. If you go there, you'll see, and it's not hard to find because they're all centered around campus. When you walk in, it's all young people, college-age people, mostly there with fake IDs. Of course, the health department says they don't even check IDs a lot, but it's almost all young people. The hookah bar owners demand an exemption. We're getting rid of hookah, we're just getting rid of the candy flavors. They contend that all hookah is flavored. If you get rid of the flavors, you must get rid of hookah. This is not true. The bar owners from years ago said, all of our patrons smoke. If we asked them to go outside, our bars were closed. They were wrong. The hookah bar owners are wrong as well. First, some terminology. This is the device, the water pipe, called hookah. What you have in front of you there is the stuff that goes on top, the shisha. The shisha is a mixture of, in this case, tobacco, glycerol, dyes, sweeteners, and a whole variety of thousands of different chemical flavorings. But this shisha that you have in front of you is completely different than the traditional shisha that comes from 100 years ago. That shisha was tobacco, sometimes mixed with molasses or water and heated. This is a completely different thing. It's kind of like traditional tobacco is like, start early, because I haven't talked that long. Traditional tobacco is like a muzzle-loading flintlock rifle compared to this shisha, which is an AK-47 with a 30-round mag. Plain shisha tobacco is available. You can buy it. You can also take traditional tobacco, which is there on the last tin, and mix it with glycerol and have the exact same consistency, but no flavors. That's possible as well. Hookah involves, of course, burning charcoal. If you walk into a hookah lounge, it's kind of like having a living room where you bring in your Weber grills, light them up, close the doors, put hamburgers on the grill, sprinkle them with Roundup, and then sit there for 2 hours. There's no reason that you would want the employees of hookah bars and the kids that are there to get a special exemption to continue this.
Thank you, Mr. Crane.
You've given nicotine users a full year to do this. They can adapt. Thank you very much.
Thank you, Mr. Crane. I'm gonna give this back to you. Thank you, officer. Welcome, Mr. Wellinghoff, and following will be Dr. Jeffrey Marable. Thank you.
Thank you. Good evening, President Pro Tem Brown, Councilman Favor. Thank you for the opportunity to speak with you today regarding the proposed flavored tobacco products ban in the city of Columbus. I'm with the Kilson Dayton Company. We're an Ohio-based wholesale distributor. We have a warehouse off Harrison Drive on the west side of Columbus. My company does not sell to the consumer. We sell candy, groceries, beverage, and yes, tobacco to convenience stores throughout the city of Columbus and surrounding areas. My company services approximately 158 small businesses in the city of Columbus. Of those, 127 of them sell potentially banned tobacco products. In 2022, thus far, I'd like to point out that these 127 stores account for $17 million in sales through the middle of November for my company. In many neighborhoods, the banned products account, or the potentially banned products, account for upwards of 80% of the revenue my company derives from these stores. In the first session held back in October, a map was presented showing where many of the stores that sell tobacco were located from a density perspective, and also showing how those locations overlap with predominantly black neighborhoods. You may recall from this the density of the stores in the northeast and southeast Columbus quadrants. I compared this data to the location of Kroger, Walmart, and Giant Eagle stores in those same areas. I found that these big box retailers do not have locations in these neighborhoods. You may remember my testimony back in October about the prevalence of food deserts. These areas of Columbus are effectively food deserts due to their distance from the nearest big box retailer. That said, there are markets in these neighborhoods. They are not Kroger's, but they are places like Nabby's, Super Saver, Linda's Market, Willie's Market, Big R Market, Briggs Market. In these neighborhoods, they offer what Kroger's food-based business model, based on Kroger's incredible buying power, will not. These stores are small. Their gross revenues for many of these stores is well under $1 million a year. My sales of potentially banned tobacco products in many of these locations ranges from $100,000 to $350,000 a year, depending on the store. A couple examples. Linda's Supermarket at 2165 Courtright Road. So far this year, I've sold $120,000 of product in there. 99% of that would be banned. Willie's Market, 1917 Hamilton Avenue. I've sold $185,000 worth of product into that store this year. 91% of it is banned or would be banned. When these small businesses lose this revenue, it amounts to a material loss of revenue for these stores, and these are the only stores in many of these neighborhoods. Can council truly risk the closure of these stores and potential loss of some of the last places the residents of these neighborhoods can get a loaf of bread, a gallon of milk, or a frozen dinner? Stronger food buying power in these neighborhoods is not the solution, or Kroger's would still be there. Thank you.
Thank you for your testimony this evening. President Pro Tem, do you have any questions? The markets that you referenced, are they, what kind of stores are they?
They're neighborhood convenience stores. A lot of them generally don't even have gas pumps out front. It's just a, I actually brought a couple of pictures. Be happy to pass them up to you, but this is one store. Okay. You can see he's got there's a cooler on the right there. The cooler has, bread products. There's another cooler in the store. It has dairy products, meats, cheeses, frozen dinners, that kind of thing. They're not pretty to look at, these markets and these stores in these neighborhoods, but they serve a purpose in these neighborhoods that there's the nearest big box store is 5 miles away. And the people that live in these neighborhoods, that's their only option, or that's their most convenient option. Because to take the bus from your home to Kroger's to do your grocery shopping and then take the bus back, and it's not exactly an easy process, okay? And transportation may be limited in terms of access for the residents of these neighborhoods.
Thank you for that perspective. I appreciate your testimony. Yes, President Pro Tem.
I appreciate what you're saying here, and I understand this tension. From what I know, tobacco products are pretty profitable. Margins pretty good.
Can be, yes.
So if I'm a store owner, there could be a real incentive for me to stock my store with a profitable, addictive substance, and maybe not dig in and do a little more on the food side of my store. That's harder. The products have a different life cycle. So I do understand what you're saying about the product split. And that I think what you're kind of saying is that because of the existence of these tobacco products on the shelves, these stores can exist, which can then sell these other things. But I'm really grappling a bit with that premise that we should put poison on shelves in order to have a loaf of bread also nearby. I think we can do better than that. And given the long-term effects on the health of the community, that's not really a product split that I think we have to be wedded to as a community. So I don't want to say that I don't understand your point, but I am very much grappling with the premise.
May I respond?
Well, actually, we do have to move on because, believe it or not, we have 42 people that have signed up to speak. And unless you want to be here till midnight, we better keep moving forward. But I will say to this point, to President Pro Tem's point there, Councilmember Bankston acknowledged this tension as well, and put some of the onus on us being that convener to open that supply chain to our small business grocery stores that you're talking about right now, to start those conversations about what it looks like to offer healthier products in our community, that if you are going to be the stopgap and fill in the gap, if you will, for those big box stores that are not located in our food deserts, let's make sure that those shelves are stocked with healthy items, not just your staples, but the things that a big box would offer, but just in a smaller setting. So your point is very much appreciated, and we definitely appreciate your testimony this evening.
Thank you.
Thank you. Mr. Maribel? Following Mr. Maribel is Todd Hicks. Welcome to council.
Thank you. Good evening, Madam Chair. Good evening, members of City Council. My name is Dr. Jeff Marable. I'm the Chief Clinical Officer of Primary One Health and Medical Director for Women's Health and Family Services at Columbus Public Health. I support the limiting of flavored tobacco, like many of my colleagues have previously stated. Although vaping may be considered a safer alternative to tobacco, it has been associated with lung injuries and death. In February of 2020, the Center for Disease Control and Prevention confirmed close to 3,000 cases of e-cigarettes or vaping use was associated with lung injury, including irritation and inflammation that may lead to permanent scarring. Research from the Johns Hopkins University on vape ingredients published in October in 2021 concluded that chemical ingredients in vaping products, most of which have not yet been identified. Among those that were identified, potentially harmful substances, including pesticides and 2 flavorings linked with possible toxic effects and respiratory irritation. Nicotine is the primary agent in regular cigarettes and e-cigarettes. I think we can all agree that nicotine is highly addictive. It raises your blood pressure and spikes your adrenaline, which increases your heart rate. And for those who are addicted or become addicted to nicotine and do not have access to it, it can cause significant withdrawal symptoms, including anger, frustration, anxiety, difficulty sleeping, anxiety, and depression. So the question is vapor a safer alternative to cigarettes, or can it be used as a cessation tool to stop smoking? The data is still emerging, but what we do know is that nicotine replacement products, such as patches, gum, lozenges, as well as counseling and group support, is a much safer alternative. Thank you.
Thank you, Doctor, for your testimony this evening. Todd Hicks. Following Mr. Hicks, Amanda Turner. Welcome to council.
And I would like to thank the council for allowing me to speak this evening. I think this is a noble cause. But I do believe that there are much more issues out there that need to be addressed within the city besides flavored cigarettes. If we're going to ban something, or we're going to ban flavored cigarettes or tobacco, let's ban them all. They're all harmful. They all kill. And for the council to say that for the black and brown community, I'm part of that community. I'm educated. I can make an informed decision for myself. I don't need the council to do that for me. let's concentrate on gun violence. Let's concentrate on education. Let's concentrate on youth obesity. Those are some of the issues that I think are more prevalent than flavored and menthol cigarettes. I myself smoked menthol cigarettes 20 years ago, 25 years ago, and I quit. I saw what it was doing, where I was starting to develop a cough. I was slowing down, wasn't being able to do the things that I wanted to do. Plus, I didn't want my kids to see me smoking cigarettes daily because I was addicted to it, but I quit. And I will say, I did happen to bring this today. This right here, this packet is 99 cents. And I'll be honest with you, at my store, really the only thing it's used for is to smoke marijuana. That's it. It has no other purpose than that, in my opinion. It's just my opinion. It is a wrap. It's called a wrap. It's 99 cents. They're cheap for a reason, because they know what it's for. A lot of times you'll see people come through for this with pennies, dimes, nickels to buy this, but they're putting something in there that they paid $100 for. Why? I don't know. So, but I think that education is the key. That's what we need to concentrate on, educating the public. And if we do that, less people will partake in this. And the last thing I'll say, that the black and brown community, they don't vape. They really don't. If they do smoke, they'll smoke menthol cigarettes, but most of them don't smoke either. It's marijuana.
Well, thank you, Mr. Hicks, for your testimony this evening. I'm going to provide an opportunity for our health commissioner to respond specifically around the question around the targeting of black and brown residents. I believe it's well established that big tobacco has historically targeted black and brown communities. And to that point, there really has been two conversations that have been tracking this entire time, which is around menthol, which we know many of our black and brown residents do prefer to smoke, and vape, which we we know has a youth element aspect to it. But I will also say that I believe from a council perspective, we can all acknowledge that there are a lot of harmful things that are happening in our community, but I, for one, believe we can walk and chew gum at the same time. So as we're having this conversation, we're also working to legislate around gun violence. Literally, just held a public hearing last week talking about 3 measures that we're getting ready to roll out. So we're looking at all of the harmful things that are happening in and around our community, and definitely doing our best to prioritize that. But when we have our health commissioner sounding the alarm, if you will, to this crisis that is happening in our community and historically has happened in our community, I think that it would behoove us not to provide space for these conversations to occur. But Dr. Roberts, let me allow you an opportunity.
Sure. Thank you, Chair Favor, and thank you for your comments, sir. I would just reiterate what I've said and what Councilmember Favor said about tobacco products. And we know that particularly menthol is targeted towards our minority community, particularly our Black communities. I mean, you're old enough to remember the ads with the cool smoking guy with the hat and things like that. And that was intentional to entice people that look like you and I to start smoking. And when talking to smokers, and you said you were a former smoker, you know that cool menthol makes it so much easier to smoke. It's so much smoother, and that gets you started on this addictive process of continuing to smoke cigarettes. And so the way they've targeted, I mean, if you go to a gas station or a liquor store on the east side versus one, let's say in the upper Arlington area or even like in Clintonville, the ads that are just outside the store are so very different because they're targeted to our community to get us to buy those products.
Because the market's different. It's not, they're not targeting, they're targeting to the market.
Well, I would argue that the market is different because of what they started in the targeting 20 plus years ago. So this is a long-standing target, how they targeted the African American community.
I would say my number one cigarette in my store is Marlboro Light,
Well,
not a
Okay.
menthol.
well, sir, let's provide the doctor with an opportunity.
I also want to address some of the other health issues that we have in our community, and Chair Favor said it best. I mean, we know gun violence is an issue, and the council is working quite hard with City Attorney's Office, with Mayor Ginther, to try to do everything in our authority. And some of the challenges our authority to reduce the harmful issues of gun violence in our community. You mentioned childhood obesity. We have done a lot with childhood obesity. We have worked very closely with Columbus City Schools so that they can provide healthy food to our students who go there, to make sure it's a balanced meal and to make sure there are fruits and vegetables. And some of these products are coming from Ohio farms. So there are a lot of things we have done, maybe behind the scenes, maybe that didn't require council legislation, but we feel, and I feel very strongly, that this is something that we need to do, not only for our Black and brown residents, but for all of our residents. And you said, well, why not ban all cigarettes? That could be, but I'm not there at this point. Right now, I'm focused on flavored tobacco because I know it's enticing to our minority community, but and you mentioned vape products. Our youth do use vape, and our Black and brown youth do use vape products, and they are able to get their hands on. I would argue differently. If you talk to any of our Columbus City School teachers and principals, they could show you baskets and boxes of vape products that they have collected. So I would argue with you that it's not as small as you might think.
Thank you so much, Dr. Roberts and Mr. Hicks, for your testimony this evening. Amanda Turner, welcome back to council. And following Ms. Turner is Ozzie Kaheen.
Good evening, and thank you, Chair Favor, for having us tonight, and thank you for the rest of council for being here. My name is Amanda Turner. I am a Columbus resident. I'm also the Executive Director for the Preventing Tobacco Addiction Foundation and Tobacco 21. We are a national organization based here in Columbus, and so we work on the federal, state, and local level to introduce legislation to prevent tobacco retailer access to kids. We are also a member of the Coalition to End Tobacco Targeting, which is 130 local organizations in support of the ordinance proposed by Columbus Public Health. And we ask that you pass this ordinance with no exemptions. So because I come with a national perspective, I just want to talk about exemptions today. Exemptions undermine the effectiveness of a policy. There are two examples I would like to note today of where exemptions have failed the community. In Oakland, California, there was a study that came out recently by the CDC that published a user guide on tobacco retail strategies to promote health equity. In it, they highlighted a case study from Oakland, California to demonstrate the harm that an exemption can do. In 2017, in response to the youth-flavored e-cigarette epidemic, the Oakland City Council worked to prohibit the sale of menthol and flavored tobacco products. However, at the last minute, the City Council exempted adult-only tobacco shops, thus creating a loophole. This loophole was exploited by the tobacco industry and resulted in a proliferation of tobacco stores in low-income neighborhoods. Retailers start defining themselves as adult-only shops by converting all or part of their stores to sell primarily tobacco products. In just 3 years, Oakland went from having 5 tobacco shops to 56 tobacco shops because of this exemption. Thankfully, Oakland City Council realized this mistake and unanimously voted to end this exemption in 2020. I would also like to submit at the end of my testimony a written testimony by Micah Berman, who's an associate professor of public health and law at The Ohio State University in regard to the proposed hookah exemption. He presents another case study of how exemptions can create more dangers for the community. There's been a lot of talk today about Toledo. And in Toledo, we have been conducting undercover buys in the past week, and we're going to submit a report to council next week to show what our results are. As of last night, we had youth, underage college students who work with ODH to do undercover buys in other communities. They attempted to go to 20 stores. That was convenience stores, gas stations, and vape shops that are considered the 60%. They were successful at purchasing in 14 stores. They don't present a fake ID. They weren't asked for an ID. And they were offered deals, and they were given vape products. They also found products that are considered pod or cartridge-based, which supposedly are not allowed to be sold in Toledo. So we will present you with our summary and our findings by early next week. So in closing, I just ask that you try to avoid exemptions because it's a slippery slope and creates loopholes that the tobacco industry will.
You can go ahead and finish her.
Thank you.
Thank you, Ms. Turner. Do you have any questions? Thank you. Oh. Welcome, Mr. Kaheen. Following Mr. Shaheen, my apologies, will be Michael Coleman.
Yep. Thank you for your time. How you doing, City? And good evening tonight. Thank you very much. My name is Sazi Shaheen. I'm the owner of Break Smart, Columbus, Ohio. My business employee, 12 employee, and the flavor banned in tobacco. It will tend to ban it back. My business employee, 12, and a flavor tobacco product, and intend to ban make up about 40% of my sale. I'm here today to oppose the order of that would be ban the flavor tobacco products. How do I make 40% of loss of revenue? Probably cutting hours, cutting employees, and if the things go worse, I might go close. Just look, other cities have passed a similar law. Dulce, Minnesota's June 2018, banned through December. Total tobacco sales were down 53%. Within the city limit, store has 1 mile from the city limit went up to 62% in the same period of time. So trying to ban this in the city, people will drive around to get it what they wanted. They gotta follow city to city to get what they wanted regardless. Doing this just only harming our business in a small business and small communities. We're here to help the city. We've been in the city for over 30 years. We live, we born, we raised, we grow up here. We try to help. The school in our community, it's bad. So everything we close our stores. That's mean our property tax, it go. 80% of my property tax to my businesses all go to the City of Columbus school. We need to educate more people, not let it. We have a problem in our school cities. We don't have enough money to pay for the school, to repair, to fix. Our city from the Columbus, because we did not collect enough taxes for people. If we close more businesses like ours, supporting the city and the community, we are losing more money for the City of Columbus. Educating people, educating. We cannot be educating. Our business job is not to educate the parents. If the kids, he's underage, he's under 18, the parents, I am a dad of 2 teenagers. I am the one who's responsible for educating my kid to use it or not to use it. They have to freedom. They got to learn. If they know what they do, if I was a smoker, my kid is not a smoker. I educate my kid right. If they said nicotine correctly is addicted, caffeine is worse addicted. I'm a coffee drinker. I'm a caffeine addicted. I cannot go wake up in the morning without drinking my coffee. If that's harm, that's harm, that addiction. People are drinking. In my stores, I basically sell all kind of energy drink. Energy drink is worse affected to the kids than nicotine. Maybe, I'm not sure. I'm not a doctor to know, but I know all the other stuff we do sell. People need to be educated. Thank you.
Thank you for your testimony this evening. Yes, President Pro Tem?
I don't have a question. I just have to say that caffeine and nicotine and tobacco are not in the same category as addictiveness or harmfulness. That one's over here and one we can't even see in the building. So just want to be pretty clear about that. I appreciate your passion, but I'd like to just leave the facts
I do
out there.
understand, like the caffeine, it's also addiction, a problem. Like if in my store, I know I sell Mountain Dew. Let's see Mountain Dew. Who's got targeted Mountain Dew? So Mountain Dew is like I sell 3 more times than anything else in my stores.
I get it. And again, caffeine,
I appreciate it. Thank
nicotine,
you.
not
I'm
in the same
a doctor,
building.
I'm not a scientist, but that's what I explain everything. Thank you.
Appreciate it.
And to that point, I would also, head over to our Assistant Health Commissioner from that to get the health perspective if we're talking about the addictiveness of caffeine versus nicotine.
Absolutely. And so I won't deny that there are oftentimes the perceived addiction or addiction even to caffeine in this case. However, I think Dr. Roberts made this point, and this point was made last night as well. Mountain Dew, when used as intended, does not kill its end user. A tobacco product, when used as intended, kills its end user. That's the difference, and that is the clear distinction in public health's mind between those two products.
Thank you. Mr. Coleman? Following Mr. Coleman will be Muhand Al-Shuri. Welcome back to council.
Thank you, Chairwoman and Councilmember Brown. It's indeed a pleasure to be back here before you once again. And I want to, first of all, commend you, all members of council, for looking at this issue. Because this is a tough issue. And you're weighing and balancing this. You're giving people an opportunity to speak. And that's the way it ought to be. That's what democracy is all about. So I appreciate that. So I just want to touch on a couple things, and I'll be brief. One is rational basis. I've heard that word, couple words here a couple times tonight, and it's very important. So at least as it relates to the health of our kids, there is no rational basis to distinguish between a vape store and a retail store. There's no rational basis to distinguish between throwaways and more permanent vapes and pipes. No rational basis between expensive and inexpensive vapes. There's no rational basis between the difference and the different kinds of flavored tobacco products. But there is a rational basis and a compelling reason to end the sale of all flavored tobacco products across the board, and that's the lives of these kids that we have here today. Each and every one of them is exposed to this, whether it's expensive or cheap, whether it's in a vape store or retail store. It is their health is why we are here today. And so that's why they're here today, is to say, look, save our lives. Our lives are as important as profit and big tobacco companies. And so, last thing. I'm from my hometown, Toledo. I love Toledo. It's a great city. I love it. But when I heard that last night, 14 out of 16 vape and other stores were caught selling to young people, it tells me one thing: exemptions don't work. When I hear that in Oakland, California, when the city council repealed the exemption for vape stores because of the harm it did to young people, black people, and low-income and Latino people, it tells us that their experiences of exemption just don't work. I appreciate your time, and I do appreciate your effort. Thank you.
Thank you for your testimony this evening. Mahand Alshuri. Mahand Alshuri. Tay Darwish. All right. Following Mr. Darwish will be Mike Billman. Welcome to council.
Thank you all for giving me the chance to speak tonight. I am speaking in opposition to the flavored tobacco ban, yet in saying that, I am not here to persuade or change anyone's mind on the matter because there are two sides to every coin. I simply would like to share my side of the coin as a minority who operates a tobacco business within the city of Columbus, but I don't want to talk about money. A point of argument I disagree with from the last meeting and this one involved a lot of numbers and statistics that showed the impact of nicotine addiction on Black and brown communities. While these numbers absolutely uphold a certain level of validity, they don't apply to everyone. And if this is truly the people's house, I feel as if we must understand that once you acquire a certain amount of education and or wealth, you inevitably remove yourself from the commonality of the people who haven't reached that point yet. So to remove the legal consumption of flavored tobacco based on numbers and statistics seems unfair to me. I can't speak for Black, nor for all of brown, but I feel confident in saying most of us are tired of being a number or statistic in the face of society. The contents of our character are composed of much more than just our ethnicity and whether or not we choose to have nicotine as a vice. In my opinion, with no disrespect intended towards anybody, numbers mean nothing in the face of reality because everyone's reality is different. Especially when I've asked numerous Black and brown individuals what they think the number one preventable cause of death within our communities is, and the answers I received from their reality were the following: gun violence, gang violence, opiates, hard drugs, pride, ego, ourselves, and the list goes on without a single mention of tobacco, which, in my opinion, should be the least of our worries. And I wish I had more time to paint a clearer picture as to why I feel that way. But I see things with my own eyes on a daily basis that a lot of everybody watches on the news. So believe me when I tell you, tobacco is not what's killing a majority of Black or brown. Yet we are Black or brown. But more importantly, we are individuals with the right to make our own choices. If we wish to change an individual's choices for the better, I believe the best way to do so is to give them another perspective and or educate them. Many of you here can understand the consequences of setting ultimatums for individuals who don't want to change their habits. The intention behind this ban is applaudable. The delivery is counterproductive. So I ask of you to strictly enforce the existing laws that prevent the sale of tobacco to our youth. I ask of you to create new ways of educating our youth about the effects of tobacco. I ask of you to go after and dismantle targeted advertising. I ask of you to understand that nothing we say or do in this room will ever solve a problem within its entirety. Even if this ban were to go into effect tomorrow, youth will still get their hands on tobacco products, and the legal consumers of these flavored tobacco products will have to source it from unregulated sources. I ask of you to not solve one issue by creating so many others. And I ask of you to forgive me for a lot of what I said can be interpreted as definitive or conclusive. It is not. It is my reality. It is my perspective. Honestly, I'm almost at a loss for words from hearing what I've heard today. Just given what I see on a daily basis and the conversations I have with the people on the streets of Columbus, I promise you, not a single one of them would look you in the eye and tell them that I worry about flavored tobacco. Thank you.
Thank you for your testimony this evening. Mike Billman. Following Mike Billman will be Michael Cole.
Hello. I apologize in advance. I made my notes here sitting back there, so I have a bunch of scratches on my paper, and it's going to be, if I'm all over the place, I apologize to everyone. I do want to start off before I forget. I did hear the health commissioner say tonight that I think I heard that she would consider a ban on flavored soda when that was brought up as other vices or things that, where do we draw the line? I think that was brought up in the last meeting, so someone brought it up tonight. And I think she said that she would consider flavored soda. So I bring that up first because I think that's kind of the main, we all agree that nicotine and tobacco are bad for our health. But the main thing tonight, for me anyways, is that this is a personal choice that someone should be able to choose whether they're black, brown, white, anything, low income, high income. She also mentioned, that she doesn't see the same things in Upper Arlington as she does on the east side and other areas. My one store is basically Upper Arlington. I'm on the north side of Henderson Road. The other side of the street is Upper Arlington. And I've been to every meeting except for the last one, and I talk to my customers who are black and brown and low income. And they all are livid at this, that this is even an option. I tried to play, you probably remember, I tried to play a video of some of them speaking, and the time got to me and I didn't get to it, but I have, if you want to see them afterwards, I have video of people, black, brown, low income, high income, that cannot believe that this is even on the table because they say, this is my choice, I'm not affecting anyone, please don't take this from me. And I brought up at the other meeting that this could be someone's personal joy, and I know that sounds funny, but to some people, this is what they choose to do. They like to do it. They know the risks. Let them choose. These are adults. Let them choose. And I don't know how else to say it, and I'm not trying to be rude, but who do we think we are to try and tell adults that they shouldn't be doing a product that is legal? It's up to them. Everybody that's in favor of this ban doesn't use the products. Doesn't that seem odd that the people that don't use the products are the ones that are trying to ban the products, okay? That in general, if you're talking about any kind of ban, that just seems wrong. You're trying to tell someone that we should ban that product that you use. I don't use it, like me. I quit flavored tobacco. There's other people in the room that have said they've quit, okay, that are for the ban. That doesn't seem right. Whether you use it, whether you've quit, okay, if you don't use that product, you should not be trying to take that product away from somebody else. These are adults. Let adults choose, okay, what they want to do with their own body, their choices, okay? It's not affecting anybody else. That's it. Thank you.
Thank you, Mr. Billman. Michael Cole. Following Mr. Cole will be Wendy Hyde virtually. Welcome back to council.
Thank you. Good evening, Madam Chair, members of council. Thank you so very much for this opportunity to address this august body in this community on a very important topic for the children of our community. I'm here as a member of the Columbus City School Board of Education, a parent, and a city resident, a very passionate city resident on issues that impact the lives of our most vulnerable population of people alongside our seniors, but definitely our children. This proposal, I want you to take in serious consideration to think about its impact, its intended impact on protecting and educating children, protecting and educating young people against the use of this type of product and the instruments that actually help you absorb this into your body. For us, we have, of course, in the Columbus City School District, we have policies against any tobacco use, and about probably several of them, about 3 or 4, that address administrative use of it, that address student use of it, that address other staff use of it, including classified. We understand within our own confines the dangerous and disruptive nature of this type of product. It just is. It's dangerous for our health. The science speaks for itself. It's dangerous in terms of being a distraction to children in the community and especially in our buildings. This is contraband in our buildings. This is not a place for students to be able to have this type of product, bring it on grounds alongside anything else that's dangerous to themselves or others. At the end of the day, again, I'm asking you, I'm certainly advocating strongly that you take serious consideration of adopting this legislation. We have adopted, well, we're in the process of adopting a resolution as a school board to address this issue for our children and advocacy of their wellness and their health. So I want you to do the same thing with us. I'd like you to stand with us in that process, stand together, and ensure that we don't have to disrupt things for adults, but we certainly can take the necessary steps to ensure our policies protect our children. Thank you and good night.
Thank you for your testimony this evening, Mr. Cole. Wendy Hyde, and following Ms. Hyde will be David Ambrose. Ms. Hyde, you are unmuted. All right. David Ambrose. Following David will be Mamon Samarine.
Good evening, Council. Thank you so much for having me. My name is David Ambrose. I'm a 22-year-old trans man, and I'm a founding member of OSU's club, Pascal, the People for Activism, Social Change, and Liberation, focusing on equity of marginalized groups. I'm here to speak on behalf of the queer youth of Columbus and to give my testimony on the impact of flavored tobacco products in the queer community. I was lucky enough to be in the narrow gap between the fall of cigarettes and the rise of vapes. An entire group of queer youth, a group once held in a chokehold by smoking, vehemently rejecting it due to its taste, the cost, the smell. Nobody liked it. It was a relief. I didn't have to worry about my friends befalling the same fate as my father and his father of lung cancer. The generations of smokers was finally broken, or so I thought. No more than 2 years later, the rise of vaping and menthol cigarettes began to claim my peers. The same peers who loathed the idea of smoking were carrying vapes because it tastes good, it's convenient, and there's no lighters, there's no smoke. They could even do it indoors. I've seen it plenty of times. My cousin, who I'd look up to for most of my life, had her vape around her neck like a ball and chain. She couldn't stand to be separated from it, even while celebrating her younger sister's graduation. It was like a piece of her own body that she just couldn't get rid of. My own boyfriend, who hated smoking, got addicted to cigarettes because of menthol. It allowed him to smoke. It was smoother, easier. It went down better. Now I have to watch him every single day, struggling, fighting, clawing against the itch. It is horrifically addictive, and it is so bad seeing him suffer the way he does. I can see the tiredness and the exhaustion in him as he continues to fight this battle on his own. So I'm really pleading to you, for the safety of my peers, my loved ones, everybody around me in the community. Even though it may not stop the problem in its entirety, it at least will dissuade them. These specific products are assisting in the next generation of nicotine addicts, and removing what originally began their addiction could help get us to that point that we almost got, an entire generation of nicotine-free individuals. So I'm really hoping that you can pass this legislation and help me and help everybody in the community. But thank you for your time.
Thank you for your testimony this evening. Mamon Samarine, my apologies. Following Mr. Samarine is Megan Kissel. Welcome to council.
My name is Mamon Samarine. I'm a part owner of Linda's Market. He just was talking about in the east side of Columbus. I got 2 points complaining about what they say. Beside we selling nicotine, we selling a perfect good product in our store. If you go to our store, you're gonna see a many big store like Kroger, Walmart, we have clean, we have everything for our community because what we depend on before we make money, we make customers. We make help to the community, we make friendly and family ship with those community. I just got a question. What's the difference between flavored tobacco and flavored alcohol? We got a lot of big line of flavored alcohol. It's get everybody from young people to the older people, but nobody against that. What's the difference between the alcohol and nicotine and the bars? It's the same thing. They have a fake ID. People be getting killed because they're young over there. It's the same thing. But my point is, I was in Chicago when they have a different type of taxes between Chicago and suburb of Chicago. People was going to the suburb and buy those cigarettes and sell them in the front of our stores. And when we try to talk to them and have them away from our stores, we getting shot. If you try to make that crime bigger, you will do that. If you try to have us with no businesses, my sale in tobacco or my profit in tobacco is not the higher percent like what they say. I make money more in juice and soda and then cigarette or tobacco. But tobacco is tobacco. If you want to ban tobacco, ban everything, not just flavor, because there's no difference. I like what my partner say. Most of those flavored cigars, they don't use them to smoke them as a tobacco. They use them for weed. And you try to legalize weed in this country. I don't know what's the difference between this and that. If you want to against something to those kids, against everything, against drugs, against tobacco, I don't mind to not selling tobacco at all in my store. I agree with that. But if you take him from flavored tobacco, you don't think he's gonna go to Black and Mild regular flavor? He will go there. He will smoke tobacco, doesn't matter what. Give him the choice to quit that. Give him the choice to have his own right and advise him in a school, in a community. My son in the school, I never seen advisor say something about tobacco or flavored tobacco. I never seen that from health department or from the same school. And thank you.
Thank you, sir. Megan Kissel. Following Ms. Kissel will be Shonda Meyer.
Hi, good evening. My name is Megan Cassell with the Campaign for Tobacco-Free Kids, and we're the nation's largest nonprofit solely dedicated to reducing tobacco use and advocating for public policies that prevent kids from using tobacco and helping smokers quit. And I do want to thank you all for the time and deliberative nature that you're taking in terms of addressing this issue and hearing from the community. As it relates to young people and tobacco use, 95% of tobacco users have started this addiction before the age of 21. And 80% of those individuals have started with a flavored product. And this isn't a commentary on any of the retailers who have spoken out over the course of the past several weeks. But the e-cigarette manufacturers, they're the ones who've been acting with a reckless disregard for the health of our kids. And you don't need to look too much further than the fact that the state of Ohio just settled with Juul, who is one of the original problem makers when this is demonstrating that they had no regard for the health of our children and that they were really focused on targeting those kids with their marketing, with flavors. Young people believe that these e-cigarettes, these vapes, they believe that they're harmless. The fact that we call them vapes, people think that this is water vapor. It's not. It's a candy-coated chemical cocktail for nicotine delivery. There's been a discussion of limiting one type of e-cigarette over the other, and I did just want to raise a point that there is actually some evidence that Just in the most recent National Youth Tobacco Survey that came out this fall, and this is young people self-reporting what they're using, that 1 in 4 kids are using pre-filled and refillable cartridges, or pods. The 2 of those most common brands are Smoke and Views. Those products only cost $10. Yes, there are much more expensive delivery systems that fall under that category, but there are systems that are only about $10. So as you're hearing information about these things are priced higher than kids can afford, that's not true. If tobacco is cheap and flavored, kids are going to use them. So laws reflect the values of a community. And this council has a choice on how to prioritize the health of children. So I stand here asking you to move forward without amendment the bill to end the sale of flavored tobacco, because it really is one of the most important things that you can do to reduce health disparities in Columbus and protect the health of kids. Thank you.
Thank you for your testimony. Shonda Meyer. Shonda Meyer. Shayna Wilson. Welcome back to council.
Well, hello. Thank you again for the opportunity to speak. I've had a lot of time to think about this. I've heard a lot in all these meetings. And I think where I am with this is we are having a parenting pandemic. I live in a Black neighborhood. I'm married to a Black man. The Black men in my house do not use tobacco. I do. I am a 5-year opioid addict in recovery. And when I wanted opioids, I would manipulate my family. I would do anything, drive across town, walk across town, do anything I had to do to get it. And that's exactly what is going to happen if this ban happens. It's going to create a lot of crime that we already have tons of. Like he mentioned, I have a 16-year-old son. I've never seen one piece of literature come home from school, and he is a straight A-B student. He brings everything home. I've never seen one piece of literature come from the school about being tobacco-free. Parents are not raising their kids these days. Cousins, mothers, other siblings are raising their kids. So kids don't have that strictness anymore. So it really needs to start at home. We need better households, no matter if it's a broken community or a rich community. We need better parenting skills. That's the problem. That's why there's kids getting their hands on tobacco, the guns, the drugs. When there was the big Tide thing that the teenagers were doing, they put safety tags on and put out literature. When they did the sleepy chicken, they had to get the NyQuil. You had to be over 18, so obviously somebody was buying it for them. Same thing with these vapes. When these vapes came out, they were intended to make a smoker stop smoking. And it just got big. And there's not enough literature out there. There's not parenting out there. That's the problem. We're in a parenting pandemic. That's the problem, I believe. And thank you for having me today.
Absolutely. Thank you again for your testimony. Elliot Boyce. Following Mr. Boyce will be Ken Fletcher. Welcome back, sir.
Thank you. My name is Elliot Boyce. I'm a police officer. I'm against the ban. I've been a police officer 35 years, worked on multiple drug and gun task force. Had a grandmother that passed away as it relates to cancer from smoking. That was her vice. I could tell you, I don't smoke, don't have anything to do with smoking. are more geared towards making sure community interactions with police are solvent. I have nothing but the utmost respect for the chief of police here and the deputy chief that was here earlier, along with Dr. Roberts. But she came and said that they're not going to enforce any of the rules or any people possessing cigarettes. So basically what she's saying is, and not to counteract her, because I believe her, what she's basically saying is if somebody has a cigarette, we're not going to do anything. But the quality of life issues become when the smugglers or people that are smuggling, and that's guaranteed. Everywhere that's banned this or had anything to do with banning it basically has smuggling. But what happens when Mr. Coleman, Mr. Johnson, basically brings his truckload of cigarettes or his carload of cigarettes in, and three things happen. He gets robbed and not hurt, robbed and beat up, robbed and killed. That becomes a police issue. I talked about it before. Anything you ban becomes contraband. It's illegal. Someone has to enforce it. The slippery slope becomes now, what happens when I show up with a truckload of cigarettes, I park them out in front of City Hall, and I'm only possessing them? I go in the back of the truck, I get me a black bag, I fill it up either one day with my clothes, or one day I fill it up with cigarettes. Who's enforcing it? It's not the health department. The health department clearly showed us just a few minutes ago the fact that in 5 years, they only did 2,200 inspections. I think that was the number. So if you take out COVID and you divide it by 3 years, it's less than 700 inspections over that time period, which means the problem here isn't necessarily kids getting it because of easy access, it's because of lack of enforcement. And that's not a knack on the health department because every health department in the country is basically undermanned, under-resourced. If you basically put a pause on this, rebuild the health department, make sure they have adequate resources, and move from there, you will see a decline. We're talking about gun violence. Well, good people don't kill people. And I just read an article, Columbus, Ohio's, in the third quarter of 2022 is ranked 19th in the country as far as homicides. The number one cause of death for African-American males between the ages of 1 and 19, 20 to 44 is homicide. It's not cancer. Second, when you move that chart for black males, it becomes heart disease. Well, if you live in an urban environment, you're going to have a lot of stress, lack of sleep, and all those things are contributors to health issues. But when you talk about a law enforcement issue, there's going to be smuggling, there's going to be contraband, and the best way to really deal with this is education, treatment, and counseling. Don't take a medical model and put it into a criminal model. And that's what we're doing at this point. The other thing here is, I see a lot of top-up people, you know, the head of the health department, the deputy chief. You should make it a point to survey the police officers on the street, the inspectors from the health department. Because, see, they're the ones that are going to be interacting with these people. Just like the store owner said, when that store owner calls, it says to you, I have a problem in front of my store, and he says they're selling cigarettes, you just basically told me, or the chief just said, they're not going to do anything about it. We can't have that. That's going to create crime and problems in your city.
Thank you for your testimony, sir. I'm actually going to turn it over to both Attorney Laura Baker Morrish, because the reason why we had First Assistant Chief Potts here this evening was to answer this very question. And we must have heard two different things this evening. So Attorney Baker Morrish, if you don't mind just reinforcing what Chief Bryant has made as her directive, how the police department is going to handle these types of cases, and if we find ourselves in a situation if a truck is parked outside of City Hall and you have now started down a different criminal path of trafficking or whatever you want to call it, that is a criminal matter that will be handled accordingly.
Right, so the ordinance that's pending right now before council deals with only flavored tobacco and is a flavored tobacco ban. But the situation that you described of an individual pulling up in a truck and selling any kind of tobacco products would still be a violation of the revised code. So there are provisions of the revised code that are criminal in nature because they are not a retailer, a licensed retailer in the state of Ohio. So that is distinct. And also, I think that was mentioned about whether or not an individual possessed it as being contraband. So the ordinance pending before council tonight is not a possession ordinance. It only deals with sales. So we're not talking about possession, we're talking about sale.
Okay, which is, thank you very much.
Yeah,
But when you say that, just real quick, you say possession, so what's possession? So if you're saying, I park my truckload, I'm only possessing it, right?
Well-
Or does Mr. Like I read your ordinance, the one that basically says anyone that sells untaxed, the most you're gonna get is 18 to 16 months in jail. A truckload of cigarettes is gonna be worth $4 million.
Right.
So you talk about a $5,000 fine in maybe 8 to 16 months in
Right.
jail?
But if you're having a truck full of cigarettes and you're attempting to sell it outside of a retail establishment, and you're there for that purpose, then you are in violation of Ohio Revised Code.
So, and one other thing,
Well, that's it. That we
But
got
that's
to
not
move
the
on,
ordinance,
sir.
but I just want to real quick
I
just
know.
respond.
I appreciate it,
And
sir.
I'll just say this last thing, please, and I'll walk.
Sir.
Okay.
Sir.
Just remember, city, states.
Thank you. Thank you. Thank you for your testimony. Thank you for your testimony. Edward, I would ask for you to also make a clarifying statement because we have heard the correlation that tobacco is not,
I think the.
you know where I'm trying to go
I
here.
think the clarifying point that we would like to make as the health department for the city of Columbus, relative to the leading causes of death, and even if you want to segment that out, the leading cause of death for African Americans is atherosclerotic cardiovascular disease. That is heart disease. It remains that. The second leading cause is all forms of cancer. So I want to make sure that that record is also set straight on that point in terms of what those leading causes of mortality are in this city. That is what it is. Heart disease followed by cancer.
And you know, we take the officers' concerns very seriously, which is the reason why we wanted to have our First Assistant Chief present this evening to go down this rabbit hole, this legal rabbit hole with us to clarify any of these remaining questions as it relates to how enforcement will actually play out in real time. So I appreciate the concerns that have been elevated, and I appreciate Attorney Baker-Marsh for assisting with clarification this evening. Next, we have Ken Fletcher. Following Mr. Fletcher is Ray Miller.
Good evening, Madam Chairperson and Council President Pro Tem. I am Ken Fletcher, Director of Advocacy for the American Lung Association in Ohio. And we are here tonight in full support of ending the sale of all flavored tobacco products in Columbus, including e-cigarettes, including hookah, with no exemptions. You know, let's bring this discussion tonight back to what started it, the health of the residents of your community. We know that tobacco usage is the #1 leading cause of preventable illness and death. We know that the residents of Columbus are using these products at a much higher level than the national average. We know that out of the 5 leading causes of death and death in this community, 4 of those are either caused or made worse by using tobacco products. So there is a public health crisis, a public health emergency going on right now in this city. And this proposal before you can go a long ways towards making a difference. We know that people are using, as already been said tonight, they start using tobacco products when they are young. 95% start young, and 80% of those individuals start because of the flavors that are made available to them. We know that menthol is used as a chemical to make it more palatable to get addicted to this product. We know that it can also mask some of the symptoms when people are starting to get the health problems as a result of these, and will possibly delay them from going and getting the treatment. So a lot of your residents are being harmed by these products. By passing this ordinance, you could potentially have a greater impact on the health of your residents long-term than a lot of other measures that you may take
during your time here on this council, because so many members of the community are using these products, and we know that so many illnesses and problems can be caused by using them. If we can do anything to stop the next generation from becoming addictive. And we know that, there's been talk about, well, there's a lot of bad things out there for you. This is the only product that if you use it as intended, it can kill you. All these other products, caffeine or cheeseburgers or anything else, if you use them as intended, if you use them in moderation, they're not going to harm you and they're not going to kill you. But if you use tobacco products, how they're intended to be used, it can kill you. That's why there's big warning labels on it saying using this product can kill you. So we know that this is a product that is killing our children and killing our communities. So we should not have the slightest hesitation to do something to stop the next generation from becoming addicted. So I certainly, it's just very great that you are having this conversation, this debate, that you're considering this proposal. And at the American Lung Association, we would just urge you to go forward to approve this proposal without any exemptions, without exempting anybody, including who. Thank you very much.
Thank you for your testimony this evening. Up next, we have Mr. Miller. Following Mr. Miller, we will go back to Wendy Hyde, who will join us virtually. Good evening.
Thank you, Councilmember Favor and all of the esteemed members of the Columbus City Council. My purpose here this evening is to express to you how much my colleagues and I truly appreciate the results-oriented approach that you've taken to develop this critically important ordinance. This simply goes to show what can be developed when we focus on our goals and commit to working across boundaries. I particularly want to thank Ron McGuire for his campaign strategy and effective management style. 3 quick points and I'll promptly take my seat. Number 1, my engagement in projects of this nature is always fueled by my life experience. It is not enough for me to simply know the facts. What moves me, and I would dare say what moves the average citizen, is justice, equality, and measurable change. 2, I know this story. I lived this story. My father was an alcoholic who died prematurely with a ventilator strapped to his mouth and his chest, still addicted to Camels and Lucky Strikes. I know this story. I drove my mother to dialysis on countless occasions. I saw what high blood pressure and cancer could do to the body. Still, she's saying, don't forget, boy, when you go to the store, bring me my Winston's. I knew what renal disease was, but that's not what she was talking about. I took my younger brother to Children's Hospital for chemotherapy treatments and witnessed firsthand the loss of his hair, his weight, his strength, and his energy prior to his passing at the age of 5 years old. I know, my friends, this story. I saw my beautiful, strong sister, Patricia, succumb to mesothelioma, and my youngest, extraordinarily gifted and musically talented brother lose his life to gun violence and addiction to crack cocaine, with so much potential harbored inside of him. I know this story, and thousands of people throughout our city, state, and nation know it as well. The question is, what are you going to do about it? We've got the intellect, the resources, and the will to accomplish whatever we set out to do. Now is the time to work even harder to save the lives of our children and those who may not even know how or why they should learn to live, as opposed to accepting premature death and defeat. Thank you, and God bless you.
Thank you for your very personal testimony this evening. We will go to Wendy Hyde.
Good evening, and thank you for allowing me to speak this evening. My name is Wendy Hyde, and I have worked in public health for over 25 years. For many of those years, I have worked as a K-12 school health teacher and college health professor of community health education. Most recently, I have worked for the Preventing Tobacco Addiction Foundation as the Ohio Regional Director. But I'm not here this evening to talk about the negative health impacts tobacco and nicotine have on one's personal health or the overall health of a community. Today, I am here to talk about my why, because my why is far more important. About 7 years ago, my oldest son was 13. I picked him up from middle school basketball practice, and on our ride home, he asked me, "Hey, Mom, do you know what e-cigarettes are?" I was a middle school teacher at the time, and I said, "Yeah, I know what they are." And he said, "Well, some kid was selling them out of his locker today for $10. Once he got home, he asked his dad the same question, and his dad said, "Yeah, I kind of know what they are, but I'm not really sure." Mind you, this was 7 years ago. Soon after this incident, several parents and friends began reaching out to me as a health professional with similar questions. My son and his peers were unaware of the harm. Parents and adults were in the dark about the addictive nature of these flavored vaping products. Action needed to be taken. This became my why. But a few years later, what I learned is that even open communication with my son, educating him about the harms, and instilling secure protective factors in our family life weren't enough to keep this prodigious industry from my now 16-year-old son, who became addicted to nicotine through flavored vape products he bought at his local vape shop. My husband and I have called and gone into several of these shops knowing they were supplying our son with this illegal and deadly product. One retailer told me that my 17-year-old son was part of the preferred customer list among this chain of stores, so they didn't check his ID. Further, although my son became addicted to nicotine around the same times that Juul was hitting the market, as well as cartridge and disposable devices, this is not his preferred choice. His preferred choice are certain refillable devices. It's more economical, and what we first discovered on him when he was 16. It's small enough to fit in his wallet. Blue raspberry was his flavor of choice. He's now 20 and still addicted to nicotine. I recently asked him about his ability to buy these products. Like, has he ever had difficulty buying from a retail store? Or was he ever carded as he's young? And his response was, it's never, ever been difficult to find or buy vapes at retail shops. My son and the many like him are my why. Why I work to pass effective, meaningful tobacco control measures. Why I believe this ordinance should be all flavors, all products without exceptions. Will you join me and commit to my why? Thank you for your time.
Thank you for your testimony this evening. Next, we have Jamie Hall. Following Mr. Hall will be Anusha Vimlapati, who will be speaking virtually. Welcome back.
I want to thank Columbus City Council for the opportunity to speak again today. My name is Jamie Hall. My wife and I run Top Notch Vapor in Columbus, Ohio. I was encouraged when I read the amendments to the proposed flavor ban. We appreciate that you're listening to the conversations we have had and making amendments as you understand more about these products. My wife and I opened Top Notch Vapor almost 10 years ago. In that time, we have helped nearly 20,000 adults quit smoking. We are extremely proud of that. We have dedicated our lives to harm reduction because we have seen and are currently dealing with the deadly effects of combustible tobacco. Because we're a specialty vapor store, we are much different than convenience stores and grocery stores. Customers don't come to buy snacks or lottery tickets. Everything we sell is either a flavored vapor product or a component of a vapor product. Because of that, you must be 21 to enter, without exception. We also use third-party verification for every sale. The average age of our customer is 46. Several years ago, when the indoor smoking and vaping ban went into effect, lawmakers were able to carve out specialty vapor stores to be exempt from that ban, because the only reason for someone to come into our store is to buy vapor products. Now, due to COVID, we don't allow vaping in our stores, but that exemption made sense due to the nature of our business. We would ask that a similar exemption be made for specialty vapor stores like ours. A complete ban of flavored products would have a negative impact on public health. I'm speaking for all my customers who are scared they won't have a safe local access to buy their vapor products. After the COVID shutdown, we had a lot of customers who unfortunately went back to cigarettes. They were happy when we were able to reopen, but disappointed in themselves because they went back to smoking for that amount of time. Our customers have said if a flavor ban goes into effect, they will, and this is told to me, They will mix their own e-liquid using vegetable glycerin, propylene glycol, food-grade flavorings, and nicotine. All these things are available at grocery stores with the exception of nicotine, which is available online and not much is needed to make their product. This could have serious health consequences if not done properly in a sanitary condition. I hope there isn't a flavor ban of vapor products. As lawmakers, you can tailor the language of enforcement to truly benefit your community. If access is a compromise that needs to be made to protect our youth while ensuring safe and local availability to these products for adult customers, we would urge you to look toward Toledo and the exempt specialty vapor stores from that flavor ban. I do believe if more meaningful conversations can be had as an industry, we can help Columbus City Council understand these products better and ultimately do what is best for our community as a whole.
So, I appreciate the testimony and you and your wife's participation. You have been in almost every single meeting. One question that has come up is, the question is around banning flavor vape, right?
Yes.
Which means that regular vape would still be available.
Sure.
So for those individuals that are going to have the type of reaction that you described just now, why wouldn't they just utilize what is still available to them?
I myself have never, I tried the tobacco flavor when I very first discovered vaping. This was around 10 years ago. And I found that it doesn't taste like what you would think it tastes like. It's actually quite awful. So if you look at the customer base, maybe 1% to 2% vape a traditional tobacco flavor. Almost nobody picks a non-flavored option. In our store specifically, it accounts of 1% to 2%. So I myself use a Mountain Dew Baja Blast. It's my favorite. I use it every day. It's one of those things where I literally think that when you remind yourself of smoking, I myself included am so afraid if this happens, I'm going to go back to regular cigarettes. And I hate to say that. I wish I had more willpower, but I just don't. And for that reason, I don't think I could survive on just tobacco flavoring.
Thank you for your testimony this evening.
All right.
Anusha Vemalupati, I apologize for mispronouncing your name, who's appearing virtually. And then following will be Phasia and Anajum.
Good afternoon. I am Anusha Vimalapati, Government Relations Director with the Midwest Independent Retailers Association, or MIRA for short. We are the largest independent retailer trade association and represent dozens of small mom-and-pop service stations within Columbus. The impact your proposed legislation will have on our members is profound and will have little to no impact on stopping folks from using tobacco products. On average, 35% of our member sales are tobacco users. Our members will not be able to keep their doors open when they lose 35% of their customers to stores outside of Columbus. The customers will not quit seeking flavored tobacco because of this ordinance. They will do exactly what folks do in other regions, which is to simply take their tax dollars outside of the city. Additionally, most of the youth get these products from their parents and friends. If the city of Columbus wants to make a real and meaningful contribution to stop smoking, they need to address the real source of the problem. Stronger enforcement and stronger penalties should be enacted on the individuals providing tobacco to youths. Our members will have a difficult time keeping their doors open when 35% of their customers flee to other cities. Enact legislation that addresses your real concerns and allows your citizens the opportunity to make decisions for themselves. As many others have said, don't deprive underrepresented minorities of their power to decide. Thank you for your time.
Thank you for your testimony this evening. Yes, and I apologize. Phasia? Visa. Up next will be John Scott.
Good evening, Chair and Council members. Please save our children. My name is Faiza, and I am a resident of Columbus for 15 years. I'm an immigrant, I'm a pharmacist, I'm also a single mom for 2 amazing high schoolers. I'm also one of the numerous unfortunate parents who have seen their children struggle with the crippling trend of vaping right from middle school. It took a lot of courage for me to come here to break barriers and speak in favor of the proposed ban. I just have 3 observations I wanted to share. First, nicotine, it is everywhere. It is not just an inner city problem, it's everywhere. I have personally seen how easy it is for teens to access nicotine, as vape shops are literally around every corner. Maybe they're not allowed inside, but they will have a friend who will be allowed inside, or they will find it in the trash around the shops, in parks, in lots, in schools, churches, mosques, everywhere. Parents like me now dread to send their kids out alone for these very reasons. Second, please ponder why target the children. 2.5 million teens nationally use nicotine products, and 85% of those use flavored cigarettes. We know that the tobacco industry targets and lures young customers. Why? To become customers for life. And how? Through the variety of nicotine flavors. Nicotine has been made attractive, accessible, and easily attainable so that our youth can be pushed into the abyss of life-altering addictions. Why is nicotine different than caffeine or sodas, like other people say? Because it opens a gateway for further drug abuse. And I appreciate the initiatives the City Council is taking, but the big tobacco business strategies are much, much advanced in our research and lobbying. And by the time we do this, they will come up with something else, some other loophole. So I urge, please do not have any exemptions, because every time a vaping corporation wins a lawsuit, my heart shudders to think what will they bring up next on our kids. And with my diverse background, I also want to let you guys aware that in some cultures, smoking is not considered abnormal. It is a common occurrence in many households, but so are lung diseases. My education and religious beliefs teach me that anything ingested which is injurious to our health is not permissible. And it saddens me deeply to see people with similar beliefs vehemently opposing the change just for some worldly monetary benefits. Annually, $5 billion are spent in healthcare for diseases caused by nicotine, but we only have a handful of tobacco cessation programs for minors. Our kids are on a highway to doom. Enough is enough is enough. It is time to nip this destructive force at its roots. It is time to ignite the light of awareness and fight these evil forces. Please save our children from this new pandemic. On behalf of all parents like me against vaping e-cigarettes, please take all flavored vapes and all flavored tobacco products off the market. Thank you.
Thank you for your testimony this evening. John Scott. Following Mr. Scott will be Juliana Nemeth. Welcome back to council.
Hello, good evening. My name is John Scott. I'm co-owner of Vaporify. I am in opposition of the flavor ban. We have all had the opportunity to listen and speak about this proposed legislation. We have discussed why something is needed to be done, discussed the pros and cons of this legislation, and also the devastating impacts it will have on small business and employees around the city. All of us here tonight agree the use of electronic cigarettes and traditional tobacco by those under the age of 21 is not acceptable. Over the past 3 years, the number of youth using tobacco products has dropped over 50%. However, we agree that further action is needed to continue to get these numbers down. The legislation as it is written will have devastating impacts, including complete closure of many small businesses that have been in operation for years, some over a decade. It will remove products from the market that have helped many adults transition off of traditional tobacco and will lead them back to harmful cigarettes. New York banned flavors in 2019 and has since seen a significant rise in traditional tobacco use. This type of result is echoed around the country in other states, cities, and municipalities that have also banned flavors. Passing this legislation will cause people to switch back to more harmful products. So how do we reduce youth usage without creating a health crisis or removing these harm reduction products from the market? We agree the increased penalties for those that are not in compliance and fail ID checks that has already been added to the legislation is a good move. This will help. Restrict sales of flavored electronic tobacco products to specialty stores where sales of these products exceed 60% of total sales and require entry into these stores to at least 21 years of age. A speaker mentioned earlier that they went to Toledo and did their own compliance check and they failed 14 out of 20. I don't believe Toledo increased their penalties. And then obviously their Department of Health is not doing their job with compliance. After having multiple meetings with our Columbus Public Health, we feel that they are competent and they will make sure that stores are staying in compliance. And with the increased penalties, after 3 failed compliance checks, you're done. You've lost your license. So I believe that an exemption will work here in Columbus. I want to end with a question. I wanted to ask Chair Brown, who is now gone, so maybe perhaps Ms. Favor, you could answer the question. So from my understanding, she has resigned or has announced her resignation and taking a position with the YWCA. She is for the flavor ban. I also believe from what I understand, the YWCA is heavily interested in the flavor ban as well. Does that not present a conflict of interest and that she should recluse herself from this vote?
I will not even pretend to answer that on her behalf.
Okay, well, for the record, I believe that she should. That is a conflict of interest, in my opinion.
Thank you for your
Thank
testimony.
you.
Juliana Nemeth, and following Ms. Nemeth will be Galal Radwan.
Hello, thank you for allowing me to testify this evening. My name is Juliana Nemeth, and I'm an assistant professor in the College of Public Health at Ohio State University. My primary research is in the area of helping youth experiencing homelessness quit smoking. So I work with the youth here in Central Ohio who are experiencing homelessness in understanding from their perspectives what they actually need to access smoking cessation intervention services, and also learning from their perspective what's actually needed to help them quit smoking. Most youth who experience homelessness here in the Central Ohio area are Black and or multiracial individuals, and a fourth to a third are gender and sexual minorities. The research that I do is funded by the National Institutes of Health. I work with youth. I've characterized tobacco use behavior of youth experiencing homelessness. And here in Central Ohio, what we know is combustible tobacco users, almost 70% of youth experiencing homelessness are combustible tobacco users. And when I interview combustible tobacco users about their use behavior, their usual brand actually was reported by 88% of these youth. And an overwhelming majority of those, over 80%, reported their usual brand as a menthol brand. And so these youth are using menthol cigarettes, and not only that, they're poly-tobacco using. And so I would urge you to not listen to some of the testimony tonight. These youth are also in past week combustible tobacco users here in Central Ohio. These youth, 45% have used hookah, smoked hookah in the past month as well. 50% of them are also using electronic vaping devices. So they are using multiple forms of tobacco. When I target interventions, because to this population, over half the youth in my last sample wanted to quit in the next 30 days. Over half of the youth that I work with who are combustible tobacco users have tried to quit in the past year. I don't try to convince youth to try to quit smoking if they don't want to, but what my research really focuses on how to help them, those who want to quit. And one of the things that has been very clear is that they need environments where there's not the product. They need environments where people around them are not smoking the products that they smoke. And they need, more than half of them, their last product that they smoked, they bought at a retail shop. these youth are hunger insecure, and that also is associated with higher rates of nicotine dependence. They need to be able to go into stores to purchase food where nicotine products are not available. So I strongly urge you to pass the amendment with no exceptions to hookah or to e-cigarettes. Thank you very much.
Thank you for your testimony this evening. Galal. Following Mr. Rodwin would be Miriam Zuzanis.
Good evening.
Good evening.
My name is Galal Radwan. I'm the business owner of Sahara Cafe, 20 East Arcadia Avenue. I'm in business since 2009. Okay, working hard to establish this business, looking for a future, okay, to have a family, have kids, raise them right, okay. Just focus in business, okay, all my effort in business to have a good business so I can start to have a family, so raise them and save everything for them, for the kids. I believe everything about the kids is to start from home. The best thing to give to your kids, the best weapon to give it to your kids to face the life, it's, first of all, raise them on a good manner. Give them the highly education. So when they know that, it becomes a principle for them. They use their mind. What is good, what is no good. Okay, put this on the side. About my business, about me. As a business owner, living the dream, having the business, working hard to grow the business. COVID-19 happened, everything that comes down, people stayed home for 2 months. Okay, businesses, a lot of businesses, they shut down the doors because of the COVID. After the COVID, it comes international economy problem. Ukraine war plus the COVID-19. Here, to solve this problem, the business issues, because the COVID-19, give the people idea like you cannot, sit close to other. You have to have a bigger space so you can sit people and people feel safe at the space. The government helped me with the business disaster loan, the SBA. I get a big amount of loan. I spend it all, excuse me, I spend it all in business to enhance the business, remodel it. I brought a very, unique furniture. That's how we start. It's handmade from back home, from Egypt. My business is a piece of my culture, an Egyptian culture. When you get into the business, you feel yourself in different country. There is the idea for that. Mostly of our customers, they come to study, they work, they do business, they do all of that. All right? After I took the loan, I spent it there, so I'm waiting for city process to finish my project. Now, when you shut it down, when you ban the hookah, what I'm going to do with my family? And what I have also for other things I have. How are we gonna survive? How are we gonna educate my kids? Everything here need money. School need money. University need money. I don't want my kids to start the life with loans. That's why I put all my effort to support them and life. So look at this from my side. I ask you, please, look at my side with the mercy of I. How we gonna survive? How we gonna live? And you ask me to have a good family, and at the same time, you fight me. You stab me from the back. You give me a loan yesterday, and you make me spend it today, and tomorrow you say, no, I'm sorry, close it out.
Yeah.
You cannot continue. Now is a question for me. Make me a favor. Think for me. What I'm going to do.
Thank you for your testimony, sir.
Thank you.
Thank you.
Appreciate it.
Miriam? Miriam? Mike Mubarak? Mike Mubarak? Archad? Archad? Frank Cahal. Welcome back, sir.
Thank you for the chance to speak once again. I'm sure after this last 40 days, you're totally tired of hearing my voice. I had an entire testimony planned, but after what other people said, I want to go back through some of the comments that were made not only by the Board of Health, but by a few other people. First, the Board of Health said that there was a vaping crisis because the tax went up in the state of Ohio. December 21st of 2019, the governor added a T21 and added vape to OTP. It was removed in the House. In Senate Finance, it was added back in as a separate 10-cent per mil excise tax, while OTP is 17%. When the bill passed on October 1st, it went into effect. So of course, the taxes have gone up in the state of Ohio because up to that point in time, we'd only been taxed at the standard sales tax rate. Then, we talked last night about England and how we can be so different with our best ally, how England's embraced an electronic cigarette as a smoking cessation device, even though we here in America call it tobacco harm reduction. So I did what I'm good at. I'm good at research. Pulled some things directly from uk.gov, org, and from two other UK. CEBR was hired by the government to do a study in vaping. One of the things that CBR said that was released 2 days ago, CBR estimates that vaping sector saved the UK 322 million pounds in smoking-related healthcare costs in 2019 alone. Then, October 21st of 19, Health UK stated that vaping helped 50,000 to 70,000 smokers quit smoking in 2017. Britain's National Health Service announced last year that they will now subsidize the cost of e-cigarettes for low-income residents trying to quit smoking. This initiative was announced by the UK Health Secretary Javid. Key findings from UK is that the best estimates that electronic cigarettes are 95% less harmful than smoking, and that if half of the smokers in the UK quit smoking and use an electronic cigarette, they could save 660 million pounds. And the difference is that we're paying for play, and they understand that they see the direct savings. Imagine the savings we could see in our welfare cost, Medicaid, Medicare.
Yeah.
That's all I got.
I have one request for you. You have also been almost at every single meeting, if not all of them. And I believe every time you have spoke, the sentiment has been the same. I have prepared remarks, but they have now been changed. Would you mind sending me your prepared remarks that you did have today?
Well, the testimony that I originally prepared today was based on the inequity between 1 year and 30 days.
Just
You fixed that.
Yeah.
So
Okay.
I didn't feel it was fair
Okay.
to beat on something that I appreciate very much.
Got it. Thank you, sir. Brittany Deffenbaugh? Brittany? Dr. Megan Roberts. Following Dr. Roberts is Dr. Daniel Addison. Welcome.
Good evening. Thank you for staying so late with us tonight. So my name is Megan Roberts. I am a tenure-track professor at The Ohio State University in the College of Public Health, and my area of research expertise is tobacco use among youth and other groups that have been historically targeted by the tobacco industry. I also submitted a letter today as part of my, as part of my testimony that was signed by myself and several of my colleagues in the College of Public Health who also do tobacco-related research. And so I'm just going to summarize some of the personal opinions that we stated in the letter. So main point being that we are in favor of the potential ban on the sale of flavored tobacco products with no exemptions. There are 4 primary reasons why we support a strong flavor ban in Columbus. First, as been discussed very heavily, menthol cigarette smoking is a social justice issue. It has been very heavily targeted to Black communities in particular in Columbus. In fact, there are tobacco industry documents that were released as part of the mass settlement agreement describing the Newport Van program in Columbus, where they would hand out free cigarettes to Black youth in downtown Columbus. We also have lots of research on tobacco retailer density showing the density of tobacco retailers, the number of retailers per capita is higher in low-income and high minority areas in the city. Our second point is that flavors make tobacco products extremely appealing to youth. They come in many different flavors. Our data show that fruit and mint menthol are the most popular, as well as ice flavors that combine fruit and mint, like guava ice. We see our students coming at Ohio State University already addicted to e-cigarettes, and we have vape and hookah stores just surrounding our campus, and students report going to hookah bars, especially after the bars, kind of as a post-bar location. Third, e-cigarettes are not approved cessation devices. In fact, no e-cigarette companies have sought approval from the FDA to be regulated as such. That would be a completely different process where they would have to go through a review of safety and effectiveness from the FDA to be approved as drug delivery devices, which is why many vape companies use terms like switching and transitioning away from cigarettes because they cannot legally use the word cessation or quit. There are, however, many cessation products that are available to adults who are interested in quitting. Products like nicotine patches and gum and lozenges, which are available, have been shown to be effective, but don't come at the cost of health disparities and youth nicotine addiction. And fourth, equitable policies in terms of their reach is really critical. There was a recent review of nearly 200 flavor bans across the US. And what they found was that the strongest flavor bans, those that included menthol and had no other exemptions, those were in more historically advantaged communities, whereas the weaker bans, those that allowed many exemptions for products or types of retailers, those were more common in high minority neighborhoods. And so to have equity, we need equitable reach in terms of strong policies. Thank you for your time.
Thank you for your testimony this evening. Dr. Daniel Addison. Following will be Alamar Ahim.
Okay, good evening. Good evening. Thank you for having me again. I'm Dan Addison, or Dr. Daniel Addison, Associate Professor with tenure at The Ohio State University. I'm also a practicing cardiologist, and I direct the cardio-oncology program and other programs in relation to cardiovascular research as well. So I think, you've heard a number of comments, I think, throughout the evening, so I'm not going to spend a lot of time necessarily reiterating that as much as to hit some of the high points and specifically focusing on data or relevant items. We know that roughly about 500,000 people die every year from smoking-related diseases. It's actually accounts for roughly about 20% of all deaths. And it's really a damaging process to multiple organs, or really nearly every organ in the body. I think we think a little bit more about e-cigarettes. So the interesting thing about e-cigarettes are that because it's fairly new, we don't fully know exactly how this will affect people decades down the line, like we knew with regular tobacco. What we do know is that at least in the lab, and then also even in the early data, like new data even presented by us at the American Heart Association and other organizations, that this does actually increase not only the damage to the actual blood vessels, but also the increase the risk of heart attack and lung cancer. We know that now. And this is relatively new data that we can at least see or at least start to glean from. It appears that the risk of lung cancer, or at least cancer as a whole, is increased by potentially up to over 200% in e-cigarette users. We know that blood pressure, even within months of use, increases by roughly 5 points, and we know that the risk of heart attack over time increases at least roughly anywhere from 50 to 200%. And again, it is likely that really by the end of this decade and the next decade, we will really start to understand what e-cigarettes have really been doing to youth and to many others. Now, importantly in all this, even though I'm a heart doctor, I do see a lot of patients in many different forms, we know that there's also an increased risk of anxiety and depression. And this seems to affect likely the young people a lot more than others. So it's important to keep in mind that we know that if we're already sowing seeds for this going forward, that this is going to be a very damaging effect over time. I think as a whole, the other thing I'd at least like to point out, I think from my colleagues, both at the American Heart Association and others, is that this, of course, disproportionately affects minorities, including persons of color, Hispanic, and Black Americans, with really up to about 80% of tobacco users in some studies now actually just using exclusively e-cigarettes. Something, again, we really don't know what it's actually doing. And at least what we know is that it's pretty damaging. As far as the UK data, there's a lot of controversy about that because many in the medical community believe that maybe the UK acted relatively prematurely to really put some sort of statement out there saying that this is actually kind of a tobacco-free or at least a way to get off tobacco product. We don't really know that for sure. All we know is that it's probably a little bit better than the traditional cigarettes. But as far as what it's going to do in the long run, time will tell, but the data looks pretty bad.
Thank you for your testimony this evening. Alamar Ahim. Following will be Sam Naimi.
Good evening.
Good evening.
Thank you for giving me the opportunity to speak to you today. My name is Ayham Alamar. I am a resident of Columbus. I've been here for about 20 years. I own Mango's Cafe, downtown Columbus, Ohio, Short North area. Today I'm speaking to you with very high hopes that my business and my culture of tradition hookah is not eliminated and granted an exemption. Hookah is unique, unlike other tobacco products. It's been around for hundreds of years and practiced by lots of cultures, including Arabs, North Africans, Italians, Persians, Armenians, and Turks. If hookah is banned and nearly 100 years of tradition will be eliminated, this will impact minority-owned businesses excuse me, that are clearly struggling due to COVID-19 and challenging the economy. Please consider an exemption for the hookah from the proposed flavored tobacco ban and protect our right to practice our culture and tradition. Earlier in some of the speakers I've heard that walking into a hookah lounge, all you smell is coals and burning flavors. So I'll speak on behalf of my lounge and majority of the lounges in the city. We all have ventilation systems, we all have exhaust fans, and we've been operating and regulated by the health department and by the city, and we only allow 21 and older to come in and smoke hookah. And the hookah was presented earlier. That is not what we carry and what we sell. As Rima mentioned earlier, the smallest hookah you'll find in our lounges is at least 2 to 3 feet long. It is an instrument that have to be set up in a physical location, and whoever purchases that have to rent it from us, sit down, socialize, study, and enjoy the experience, and purchase with it tea and snacks, and they leave. There is no addiction using hookahs, and most importantly, that we all been around in Columbus for at least, I know my business for about 10, 11 years. Hookah got introduced to Columbus at least 30, 40 years ago. We are small minority business owners, and really what I want to explain that hookah is nothing like flavored e-cigarettes or vape. It's not something you could put in your pocket and hide and go on the street and smoke. It's really a setup that takes at least 10, 15 minutes process to set it up. And the tobacco we get is fully regulated from companies from all over the states. I really hope that hookah get exempted. And thank you so much for giving me the opportunity to speak today.
Thank you for your testimony, sir. Sam Naimi. Following will be Muhammad Bashir. Welcome.
Thank you for giving me the opportunity to speak today. My name is Sam Naimi. I was born in Lebanon. I've been here since I was 5. I am 44. I am married to a black woman. I have black children. And I'm missing my son's basketball game in middle school to be here today. With that said, I have to speak very fast to get through everything. I believe that there are already laws put in place against underage sales of tobacco to minors, and supposedly the city enforces these laws. With that said, this bill is targeting adults, specifically minority adults. So what you are voting on is, are minority adults competent to make the right choices to smoke menthol or flavored tobacco? And if we vote to ban, then you, the council, are saying that we as adult minorities are not competent enough to make the decisions for ourselves. We are, why are we not banning all tobacco products? All these doctors are saying that tobacco is bad for you, and I agree with that. But that is not the debate that is set before us today. The debate is menthol cigarettes and flavored tobacco, not all tobacco. Why is that? Is a person that smokes 2 to 3 menthol cigarettes more at harm than a person that smokes an entire pack of non-menthol cigarettes in a day? We have already changed the legal age of tobacco to 21. We should enforce that more than trying to take away the rights of the American people. This is not a vote only for menthol cigarettes or flavored tobacco, but a vote on the freedoms of the American people. Doctor, you said you are a physician that cares about the people's health, and I thank you for that. I am an American that cares for my American freedoms. The right to make the choice when it comes to my own health. Also, you said that caffeine is not addicting or harmful like cigarettes. Probably not, but I used to drink 3 Red Bull 8-ounce cans a day. One day I woke up with a regular heartbeat. My physician told me that is the cause of my irregular heartbeat. I don't have cholesterol. I don't have any other issues. That is the only issue that she thought. But we are not here trying to ban caffeine or Starbucks or Red Bulls. My point, before I get to that, I would like to thank the mayor for being here. He was mayor for 16 years, but he has not brought that up while he was mayor. I don't know what has changed from 2016 to now. I used to smoke, especially when I used to drink, when I was in college. And that's when I smoked. You're gonna have people, while drunk, driving to suburbs of Columbus, like Dublin, Arlington, Bexley, to get their cigarettes under the influence. If we are going to ban it, then let's ban everything. Let's not target just a group of people. Let's not target just menthol or flavors. And when it comes to minors, we have laws set in place. People must abide by them, and those who don't must be punished. That is what we should focus on, not trying to take away rights from adults, specifically minority adults. That in itself is wrong. Thank you for your time.
Thank you, sir. Mohammed Bashir. Following Mr. Bashir is Leanne Wheeler.
Thank you for having me here today. My name is Mohammed Bashir. I'm the owner of a couple store in Columbus, Ohio. I'm here not against the ban, but I am here to raise some questions and some suggestions. My first question is same, like they ask everyone the same question. Menthol cigarettes are going to be banned, then what about the other kind of cigarettes? If flavored tobacco is going to be banned, what about the other kind of flavored tobaccos? Now my next question, what about the junk food we buy? Our kids, little kids buy and eat every day. What every single person, our kids eating every day, those unhealthy foods taking us to the heart attack, stroke, high cholesterol, high blood pressure, and disease, and how many people are dying because of heart attack. According to the CDC, 1% dies every 34 seconds in the United States of America because of cardiovascular disease. About 697,000 people in the United States died from the heart disease in 2020. What about the alcohol? Let's go to the alcohol. According to the CDC, each year in the United States, excessive alcohol use is responsible for 140,000 deaths, shortening lives by an average of 26 years. 1 in 5 deaths among adults aged 20 to 49. My question is from honorable members. Why don't we go 100 years back and we just live simple life? Stop everything and just live a simple life. While right now, even using a laptop, using the mobile phone affect your vision. So everything have advantages and disadvantages. I believe, honorable members, if you ban menthol cigarettes or if you ban tobaccos, I guarantee you, they can buy on the street very easily. Like weed is banned, but within 5 minutes, I'm the store owner. I stay there, I deal with customers every day. Within 5 minutes, for how long the weed is banned, within 5 minutes, I call someone and weed be outside. Someone standing outside the street selling me the weed, even I never smoke in my life. But it's banned. But illegally we can buy, doesn't matter how much weed we need. And even the cops, they stop you and you have a weed, they don't care. Say, okay, go, you can leave. So what I'm saying is, banning is not the solution. We can put some kind of force, like in my country, they have even if cigarettes packs, they put the sign on the warning sign on the cigarettes packs, hey, smoke is not good for your health. Even when you're watching the movies and someone is smoking cigarettes, they have same time, they have a label going on, hey, smoking is not good for your health. What I'm trying to say, we can put sign in our stores and we can also force the cigarette companies to educate people. The main thing is we can spend more time, invest more money on advertising, teaching people that smoking is not good for your health. There is not only one thing, only smoking. Every single thing, even drinking pops makes, eating at McDonald's, even I go to the doctor, I'm a high blood pressure patient, and doctor told me, stop unhealthy foods because you will die because of a heart attack.
Right.
But I don't stop.
Right. I appreciate that testimony, sir. And just to answer your question, we are not here to argue about how many bad things exist in our society. We could talk ad nauseum about what those things are. But we are here today because the health department has identified tobacco, flavored tobacco, and menthol as a public health crisis. And in 2020, Columbus, Ohio, and Franklin County declared racism to be a public health crisis. What that means is that we now, as legislators, need to start identifying those things that exist within our community that fit within that declaration of racism being a public health crisis. It's not just a statement that we should just say, and it carries no weight with it, right? But that's why we're here today, to start truly unpacking what that means. And so I get it. I understand soda is bad, hamburgers are bad, all of those things are bad. Those aren't public health crises that the Public Health Department has identified that we as legislators need to address in the city of Columbus. So
the last thing what I was trying to tell you, the tobacco, 99% tobaccos we are selling in the stores, they just use for weed. So
understand.
If weed is banned, if there is no weed, nobody gonna buy the tobaccos.
Understand.
So you guys are going to ban tobaccos, but weed is still there.
Understand.
They can use their weed somewhere else.
Understood.
So it's just, I'm feeling it's just targeting retailers.
Okay.
Look, I'm giving the example like weed
It's okay, sir.
I mean to say.
It's okay. Thank you for your testimony.
I hope you understand what I'm trying to explain.
I absolutely do.
Thank you.
Absolutely. Thank you, sir. Leanne Wheeler. Following Ms. Wheeler will be Timothy Liggins.
Madam Chair, thank you. I want to hit on a couple of points we've not heard on this evening. I don't think it's common knowledge that traditional big tobacco as an industry is bought into the vape and e-cigarette industry. They are not two distinctly different industries. What happened, two dates I'm going to share. In 1998, state governments reached a 25-year, $246 billion deal with the country's largest tobacco companies. They have been paying states. That money ends next year. 25th year from 1998 is 2023. They were, in fact, held accountable for their targeted marketing in Black community, outright lies about what they were doing with regard to marketing and sales, and the unhealthy nature. That's where we got the warning label from, was the 1998 action. So I wanted to share that. And then what we haven't said, and I appreciate the work that we're doing here locally in Columbus, Ohio, what we haven't said is that the 20th Surgeon General of these United States of America proclaimed in 2018 that youth involvement in nicotine addiction as an epidemic. So that declaration came in 2018. We've got a problem that we need to consider state by state, as a nation overall, and certainly by locality. I've got a couple of questions too. I've heard a lot of folks pose some questions. When we hear about folks who are adults and adult choice, the question I have is how old were you when you first accessed a nicotine product, and where did you get it? Because by the time you're an adult who smokes, you've been addicted to nicotine for a while. I don't know too many 35-year-olds or 55-year-olds that are just going to start smoking. And then what I wonder is if there's been a thought about how else, and I appreciate the discussion around cessation, how else might you spend that money if you weren't addicted to nicotine? As we talk about our personal economies, our communities, our households, how would you spend that money if you were not, in fact, addicted to nicotine? And I'll share this story. My father passed at 80 years old from non-small cell carcinoma of the lung. Smoked since he was 12. And this was a very question that I would ask him, or when he would ask me about things. I'd say, this is how many cartons of cigarettes this thing cost. If you weren't smoking, perhaps this is something you can invest in. So I thank you for your time. Those are the questions I have. And I look forward to hearing what we come to as a community and as a city with regard to this legislation. Thanks for your time, Madam Chair.
Thank you for your testimony this evening. Timothy Liggins. Following Mr. Liggins is Abdullah Ansar.
Good evening, Chair Favor, and to members of the council. As pastor of Bethel AME Church and president of the Columbus Area AME Ministerial Alliance and co-chair of the Concerned Linden Clergy Group, I rise to speak in favor of ending the sale of flavored tobacco products. The reason why we take a stand against gun violence is because an average of 12,000 African Americans in this country die each year from gun violence. But over 45,000 African Americans die each year from tobacco use. So shouldn't we do something about that also? Most people are repulsed by the taste of tobacco at first puff. But flavored tobacco is what draws our people to smoking. I speak from firsthand experience. The tobacco industry added flavoring for the purpose of getting our people hooked. They don't care about their health, they only care about profits. That's why they want our people addicted. They don't care if they suffer from emphysema and other lung and health conditions. They don't even care if they die. But do we care? We do care that they live. We do want them to be healthy. But just caring is not going to change anything. We must act. Whatever we can do to save lives, we should do it. Whatever we can do to increase the quality of life for those in our community, we should do it. Sometimes in life we must make the hard choices. But when it's the right thing to do, we must rise above the criticism and persevere over the opposition. If we know that it is the right thing to do, then without a doubt, we must do it. As a pastor of a church in the Black community, I feel it is my responsibility to be concerned not just for the spiritual aspect of those in our community, but for their health as well. We are acting because we care. As I take my seat, I encourage you, the council members, to stand strong and make the right choice for the longevity and the betterment of the people of this great city and community. It's going to be tough in the short run, but think of the future. Think about the lives that will be saved, and never stop fighting. Know that the faith community is always in prayer for you and our city leaders, for your strength and courage, especially when you must decide between the popular choice and the right choice. Let's always fight for what we know is right. Let's always fight for our future. Thank you, and God bless you. And I do bring along with me letters in support from the Baptist Ministerial Alliance of Columbus, the Interdenominational Ministerial Alliance of Columbus, the AME Ministerial Alliance, the Eastern Union Missionary Baptist Association, and several other churches in the Black community.
Thank you so much for your testimony. Abdullah Ansar. Following will be Rocco Bellu.
Hello, everyone. Thank you for allowing me to speak today. My name is Abdullah Ansar. I graduated last year from Ohio State and took loan from a bank to start a business in Columbus City. If this ban happens, I will be out of business and won't be able to pay back my loan. I have to break my lease too. I am here again to ask that you please do not move forward with a total tobacco flavor ban. Surveys showed that 77% of voters believe that once you are 21, you have the right to make choices for yourself, including what products you buy. And 71% agree that a prohibition on products does not work, like we have seen with marijuana and alcohol. I heard Chair Favor talking about Columbus residents that are Black or brown. What about me? I am brown and have a business in Columbus. We employ other brown people and all pay taxes. Also, last night when I spoke with you, so you said $1,000 fine is nothing, it's just a very small amount. It might be a small amount for you, but for me, it's not a small amount. And yes, last night the gentleman said that fine $10,000 on first offense. But he also said that don't ban the flavored tobacco. We retailers suggested that instead of ban, you can impose hefty fines, but now in the ordinance I can see hefty fines and bans too, which is very unfair and unacceptable at all. Last night, Council Member Bankston was present and he talked about the city helping retailers enhancing our buying power to make sure we stay in business. Do you really think this can happen in just 12 months? Have you spoken with Kroger's to see if they are going to help us with purchasing power? Why rush this? This bill does not need to be passed now. Council should wait and weigh out all of the potential issues. However, if you do pass this, I would hope Council would wait to implement a ban until at least 2025 or 2026. I sincerely appreciate you allowing me to share my testimony. Thank you very much.
Thank you, sir. Rocco Bellu. Welcome back, sir.
Thank you for the opportunity to address serious concerns with the proposed ban in a public forum. As an employee of a vapor-only business in the city of Columbus, as well as a former smoker and consumer of flavored vapor products that this ordinance would impact, I'm encouraged to see that City Council is engaging, considering testimony, and actively making changes. I'm encouraged by the recognition that vapor products might deserve special consideration in some capacity as a much less harmful nicotine alternative. It's no coincidence that Dr. Roberts' line chart outlining 32% increase of other tobacco products tax collection began in 2019. That's the very same year that the Ohio Department of Tax levied a new tax on nicotine-infused e-liquids, pods, and pre-filled devices. Recently, we heard testimony that cigarettes are increasing the risk of cancer by 200%. Meanwhile, I recently read that Dr. William E. Stevens of St. Andrews University showed the risk of cancer from e-cigarettes when compared to cigarettes is less than 0.5%. These and other propagandized statistics being leveraged tonight by public figures and professionals leave me questioning the integrity of their testimony and the impact of the hearing overall. Our goal has always been to improve public health by offering an alternative to the adult public away from combustible tobacco products, specifically cigarettes, which are the most harmful consumer product on the market. We encourage conventional cessation aids. However, as a personal liberty, it is important to maintain access to reduced risk alternative nicotine products for those individuals who are unable or unwilling to have a successful quit attempt using those methods. We can do this all while furthering the historic decline that is being seen in youth use of all tobacco products. There are many different ideas that have been brought up in these public hearings and small business councils that you and your colleagues may be discussing. Restricting the sale of flavored vaping products into specialty stores, perhaps where the age is 21 plus to enter the establishment, or where revenue is defined as being 51% of sales from vapor products. Another alternative or additional idea would be instituting a third-party age verification, which would then require and mandate enforcement of T20 run rules, no matter the clerk. That option would obviously need additional investigation. Delaying the implementation of the prohibition until January 1st of 2024 for all flavored products will allow the City Council and businesses to fully explore the options to develop implementation plans. These options are based in reality. The options will further limit and deter youth access. These options allow for adults to have continued access to much less harmful alternative nicotine products. These options do not encourage an illicit market, unlike a prohibition, which by its very nature does encourage an illicit market. I would also like to add that as a vape store employee, having worked in this industry for 10 years, there are very few things at work that bring me more joy than turning down an underage sale or watching a teenager leave empty-handed with their middle finger pointed at me. So I understand the concern, we all do, and it's justified. But to be portrayed the way we are, it's unwarranted. So thank you for your time.
Yes.
And I'm sure we'll talk again.
Thank you, sir, for your testimony. And last but certainly not least is Keisha Hunley Jenkins. And welcome back to council.
Good evening, Chair Favor and members of council. Thank you for the opportunity to speak this evening. My name is Keisha Hunley Jenkins. I'm a Columbus resident, a parent, and a member of the Coalition to End Tobacco Targeting team. I come from a family that's seen at least 3 generations of targeted tobacco or targeted flavored tobacco use based on targeting. My parents fell victim to this advertising for menthol cigarettes when they were young. They always smoked menthol when I was a kid, smoking before and after dinner, before ordering food, during car rides. But my parents were very involved. They encouraged us not to smoke. They talked to us about the dangers of smoking. However, kids also follow by example. I tried menthol cigarettes. I didn't like it, so it wasn't an issue for me. My sister, however, who's 8 years younger, tried it while I was away at college and began smoking at an early age at 14. She would steal my mom and dad's cool cigarettes for herself, so that's how she started. By the age of 19, she was smoking a pack a day. In her early 20s, my sister remembers going to the Arena District night spots when she was able to run into tobacco companies who would come around and give coupons and Camel Crush packets, which would emit its mint flavor through the cigarette, so you could squeeze it and get even more flavor. It took her 3 times to quit. And while I'm proud to say that she was able to quit at the age of 27, it took her 3 tries, and she used medication to do so. Today, she and I both have kids of our own. We have seen how the tobacco industry targets our kids with brightly colored candy-flavored vape products. I'm concerned for my kids, my nieces and nephews, and all kids because I know how addictive and how harmful these products are and how young people might be attracted to try them just because of the flavors themselves, and how they smell. My parents today still struggle with health challenges from smoking. When I hear my dad in particular coughing and hacking, and I hear my mom constantly clearing her throat and needing to go outside to smoke because she doesn't want to smoke around the kids, I also have fear for my own children and others, that they could follow in these footsteps. I don't want them to have a cough or a hack at any age. Please help us protect our kids. Please protect all Columbus kids by ending the sale of flavored tobacco in Columbus. Thank you so much.
Thank you for your testimony this evening.
Thank you.
Thank you again for you all for being here and powering through 3.5 hours, I believe it's been. But it's been a great conversation this evening, and I continue to learn every single time we have this opportunity to engage with each other. I understand that this topic brings out polarizing opinions and a lot of passion from both sides. As I've shared before, this is still only a proposed version of the legislation, so we are going to continue to listen and have these discussions with you. Thank you to my colleagues, President Pro Tem Brown, Councilmember Remy, and Councilmember Barosa de Padilla that have been joining us via Zoom, Councilmember Bankston, who was also here earlier this evening, Dr. Roberts, and the team at Columbus Public Health, Deputy City Attorney Laura Baker-Morrish, and Chris Maitland. Thank you to my team and the staff here at City Council and you all for being here tonight. This will now conclude tonight's hearing. Have a wonderful evening.